हेलो फ्रेंड्स, वेरी गुड इवनिंग टू ऑल। क्या हाल चाल? सो वेरी गुड इवनिंग बेटा। गुड इवनिंग अभिजीत, Anshri, good evening to all. So, how is the life going on? All well? So, good evening, Nikita. Good evening. Great. So, friends, how is the life going on? कैसा चल रहा है? बढ़िया चल रहा है? Great. So, once again, Mist is coming with most awaited 25 most important clinical question series, and I will be the torch bearer for this series now, and we will be starting with our first subject, that is community medicine or PSM, preventive and social medicine. Good evening Khatun, good evening sports, good evening to all. As we know the importance of this subject for our upcoming exam, this subject is supposed to be quite simple, but only problem what we face is difficulty in recalling the content in the examination. So in this session, we will be discussing the questions from 25 most important topics, what we call as a high yield topics. We will be learning that how to identify the keywords, join the keywords, making a differential diagnosis, having an acting recall, coming to the correct answer. We'll not be discussing in this session only the 25 questions, but we'll be talking some pointers also from each topic. So roughly, I'll be covering around 300 questions in this session. I hope all of you know the date of our FMGE exam. It is none other than 28 June 2026. So how many days, friends, are left for this exam? It's 52 days are left. If you say that is these 52 days are enough for me to read, revise and able to have a good score in the examination, I can say a big yes. If you had some understanding of the basic concepts, these 52 days are enough. If you are studying with a full dedication, then definitely you can clear your exam. Not only clear, but will be getting the good marks, provided you will be utilizing each and every second of these 52 days before the exam. I can understand your stress level, and this stress level is having the two type of actions. In some, it may be a motivating force that under the stress you are studying more because you are more focused towards your goal, and for some it may be a demotivating factor also, because under the stress you are not able to focus properly, you are not taking care of your health, you are not eating properly, and it is having adverse effects. So what I can say, that take this stress as a motivating force, because God is preparing you to handle success stress, which is going to be there within few months. So rightly said, a quote is there that if you cannot handle the stress, you cannot manage success. So we have to handle stress as a motivating force for managing the upcoming success, what we get in the form of a pass result in our upcoming examination. So without wasting time, let us start with our first question. Now, what is my request and suggestion to all of you, that read the question carefully. Don't be in a hurry to jump to your answer. Read the question carefully. There might be some buzzwords, tricky words, which may change your answer. So here is your first question. Mother brings her 10-month baby for a routine vaccination at sub-center who had received the previous vaccine as per the schedule till this age. What vaccine will you give at the marked site? So first question is, that we have to see which is the mark site. So mark site is this one, that is on left thigh. Okay. Now these are the some options for the vaccines, and I'll be adding one more option. In this is, it is your pentavalent. Okay, pentavalent. So now here first you have to recall what is the age of the baby is 10 months. This is the first keyword. Second is that he has already received the previous vaccination as per the schedule. It means he had received the birth doses 6, 10 and 14 week doses. Okay. And now we are coming to 9 months. So first of all, you have to recall in your mind that what vaccine we are giving at a 9 month, and before moving further, you had started jumping for the answer. So first of all, let me see, because there is a tie between the two choices. What I had added in the end is, that is pentavalent also, and some is answering as E also, measles containing vaccine, and some is answering B. So whatever the vaccine is in the choices, they are given at 9 months. Like a JE, we are giving at 9 months. Pneumococcal vaccine booster, we are giving at a 9 month. Measles containing vaccine, we are giving at a 9 month. IPV third fraction, we are giving at a 9 month. Now we will be looking for the site. Now JE live, it is given by subcutaneous route. And if it is given by the subcutaneous route, it is given in the left shoulder. Okay, it is given in left shoulder. At this point, it is given. That is JE. Now JE kill, it is given by intramuscular, and it is given in left thigh. Okay, it is given in left thigh. Pneumococcal vaccine polysaccharide. Polysaccharide, we know that it is not given to children, child less than 2 years. So baby is my how much? 10-month old. So this is out of the scene. Okay. So left shoulder, live JE also out of the scene. Now pneumococcal vaccine conjugate, it is given in the right thigh. Although it is also given by intramuscular, but it is given in right thigh. So it is also out of the scene. Measles containing vaccine 1, okay, it is given by subcutaneous route, and it is given in right shoulder. So here it is given measles containing vaccine. So this is also out of the scene. Now what is left as the IPV third fraction? Third fraction, it is given by which route? It is given by intradermal. And as we are giving on the right shoulder, the measles containing vaccine, so what we are giving in the left shoulder, it is the IPV third fraction. So IPV third fraction is given here in the left shoulder. Okay, so it is given in your left shoulder. Now pentavalent. Now some of you like Shala Beta, you are answering B and G both. Now here, although the pentavalent is given in the left thigh, no doubt it is also given by intramuscular. It is given in the left thigh. But in this scenario, this is not the correct answer. Why? Because the question says that it is a baby is how much? It is 10-month-old baby. And 10-month-old baby who has received the previous vaccine. So already pentavalent first dose 6 weeks, second dose 10 weeks, and the third dose at 14 weeks, baby had already taken. So pentavalent is not here the correct answer. So you all are answering quite correct. So a big clap for all of you, and the correct answer is, that is JE killed vaccine, which is given to a 10-month baby in the left thigh. Okay. Now coming to some of the pointers here. Now we will be quickly discussing these, and wherever you are present, I just expect, or I just want that you should revise. Okay, you should just revise wherever you are. I am not going to write the answers here because it will take a long time, and our session may be going a little bit long. So I don't want that. So we will be just discussing the answer here, and just after completing the session, I will be providing you the filled PDF, and it will be given you in this YouTube session link. Okay, so don't worry about that. Now toxoid vaccine, which you are giving in the universal immunization program, the two toxoid vaccines we are giving, one is tetanus, another is diphtheria. Now what is the conjugate vaccine we are giving in UIP? The two conjugate vaccines we are using, that is Hib, Haemophilus influenza B, and the pneumococcal vaccine. Now what are the live vaccines we are giving by oral route in UIP? Now, live vaccines we are giving by the oral route, OPV and rotavirus. Live vaccines what we are giving by intradermal route in UIP. Only the one live vaccine it is given by intradermal route, and that is BCG vaccine. Okay. Now, live vaccine which is given by subcutaneous route in UIP. Now, the live vaccine which is given by subcutaneous route, it is your measles containing vaccine, may be measles, rubella as MR, or measles, mumps and rubella as MMR. Okay. Now, J live, it is also given subcutaneous, but nowadays in our program we are shifting to J killed vaccine. Okay. But earlier we were giving the J live also in the program. Killed vaccines which are given by intradermal route. Only the single vaccine, killed vaccine IPV, which is given by intradermal route. Now, here remember the one common point is that most of the live vaccines are usually given by subcutaneous route, like measles, rubella, mumps, J live, yellow fever, chickenpox, except the BCG, which is given by intradermal, and the OPV and rotavirus, which is given by oral route. Most of the live vaccines are usually given by subcutaneous, and most of the killed vaccines are usually given by intramuscular route. Okay, except the IPV, because we are now giving a fractionated dose, and it is given by intradermal for a better response. So these are some keywords. Now, polio strain which is causing the vaccine derived poliovirus, you already started answering the question, that is V2, it is causing the vaccine derived poliovirus, and P3 it is causing the vaccine associated polio paralysis. Now, vaccine causing intussusception. Intussusception is a side effect of a one oral live vaccine, that is rotavirus. Now, vaccine which is leading to neurological manifestation, hypotonic hyporesponsive episodes and anaphylaxis, that is a pertussis component, maybe of the DPT or maybe of pentavalent. Vaccine which is most commonly associated with anaphylaxis is hepatitis B. Now, most heat sensitive vaccine, it is your OPV, or we can say the dissolved BCG is a highly heat sensitive. If it is not in your choice, you can go with OPV. If it is not in your choice, you can go with measles vaccine. Now, most freeze sensitive vaccine which is damaged by the low temperature is hepatitis B. If it is not in your choice, pentavalent. If it is not in your choice, then it is the DPT followed by TT. Then VVM which is used to check. VVM is vaccine vial monitor, which is used to check for heat damage of the vaccine, and the color of the inner square changes. It is grade 1 and grade 2 we can use. Grade 1 when it is a white color or the very light blue color. The grade 2 it is a light blue, but it is lighter than the outer one. Grade 3 same color, grade 4 darker. The grade 3 and grade 4 we have to discard. Okay, shake test is used to check for the freeze damage of the vaccine. Now, disease which has been covered under Mission Andhadhanush is 12 diseases which are vaccine preventable, and if we talk about the pan India, it is 11 diseases, because the J it is vaccine is only given in some endemic states. So, this is all about our first important topic, that is related to vaccination. Now, the second question is, during routine pre-placement health checkup for industrial job, Mr. X was diagnosed as color blind. Based on genetic background of this disease, his siblings were also screened. Level of prevention is. We have to tell the level of prevention for both Mr. X and the siblings. So, what could be level of prevention here? Okay. Now, as in the question is that we are doing a pre-placement health checkup. Pre-placement health checkup means that we are taking that person for a job, and because of the color blind, there could be some accidents. So, we are trying to prevent that accident, because if he is diagnosed as a color blind, we will not be taking for that particular job. Okay. So, we are trying to prevent the others. So, basically, Mr. X is, it is the primary level prevention, although best answer will be both primary and the secondary. because he may not be knowing that he is colorblind. And if he is not knowing, then he is knowing for the first time, that is secondary for him. And for preventing the accidents, it is primary. But could be a possibility that he is knowing before, but he is hiding the fact. So single best answer will be the primary for Mr. X. But his siblings, they are not going for a job. So we are routinely screening to detect the color blind. So for the siblings, it is actually the early detection of the problem. It is secondary for them. So yes, those who are answering A is the correct answer. Mr. X is primary and sibling is secondary. Now, as those who are answering the D, as I told you beta, that it is both primary and secondary for Mr. X also, if he is not knowing before. Okay, but if you have to choose a single best answer will be primary for the Mr. X, and for the siblings it will be your secondary. It will not be primary for the siblings. Okay, so those who are answering option C, it is not a primary for the sibling, because sibling we are not taking for any job. We just want to know whether they are having color blind or not. Okay, so A is the correct answer for this. So any question related to level of prevention is asked is, then you have to see that what we are doing for that particular action. If it is trying to avoid the risk factor, so in the primordial level prevention, the risk factor is absent. Okay, if you are trying to avoid the risk factor, it is primordial level prevention, while in all the risk factor will be present. But if you are trying to prevent the disease in the presence of the risk factor, so disease will be absent in the primordial and in the primary. So primary may the risk factor is present, but there is no disease. That is what is a primary level prevention. Now secondary may or may not be the disease is present, because it is a early detection of a disease. But if we are doing a screening, sometimes in a healthy person, like we are doing a pap smear for all ladies. Okay, so it is not always necessary that they are having some cervix abnormality, but obviously the disease will be present in the tertiary level prevention. Complications are usually present in the tertiary level prevention, while it is absent in all, and the disability may or may not be present in the tertiary level, while rest all it is absent. Okay, so this is a chart which is summarizing, because exam may every time we are asked a new question. So whatever the activity is given, we have to see what it is trying to do, and based on that we can detect our level of prevention. So these are again some pointers or the buzzwords, and they can be framed in a big clinical question. If we are going for a mass chemoprophylaxis, we are giving a chemoprophylaxis medicine to the whole community, it is actually a primary level prevention. Okay, and if it already given, and it is your specific, because we had already given to the community. Now if a question says that a government is planning to give a mass chemoprophylaxis to the community, then definitely it will be a health promotion. But if nothing has been mentioned, we will be going as primary specific. The mass chemotherapy. Now, mass chemotherapy means we are giving some medicine for the treatment, which we do in a filariasis endemic districts and the states. So it is best answer is both primary and the secondary, but a single best answer is it is your secondary level prevention, because our main purpose is that we have to treat the asymptomatic microfilariemia cases. Okay. Now screening, if we say screening, if we say in simple word, screening is a secondary level prevention. But if it is a prospective screening, like we had seen that before a job we are doing for a color blindness checkup, or we are doing a regular checkup for sex workers, so it is for the benefit of others. So it is your primary health promotion. Okay, it is primary health promotion. But if it is a prescriptive screening, prescription, a person is taking its own medicine, so it is your secondary level prevention, like screening for non-communicable diseases, cancers. Lifestyle modification or quit smoking, it can be primary, or it can be secondary, or it can be tertiary. At what level we are going for? Okay, primary, secondary or tertiary. But if we go for a single best answer, the single best answer will be the primary level prevention. Now, pre or the post exposure rabies prophylaxis. Pre or post exposure rabies prophylaxis, it is to prevent the disease. Okay, so it is your primary specific prevention. Now, conventional or the emergency contraceptives, again, it is a primary specific level prevention. Now, isolation or quarantine, we are isolating a diseased person or we are quarantine a healthy exposed person till the maximum incubation period. It is to prevent the transmission to the community. So we are protecting community. So both of them is, it is your primary health promotion. Okay, primary health promotion. So these are some pointers in the topic of levels of prevention. So remember, every time in the exam you'll be given a new example. Okay, you have to apply your concept that what that given activity is going to do. I can understand your sleepless nights because you all are exerting very hard. कई बार आप इतना थक जाते हो कि अब आपका दिल भी और दिमाग भी कहता है नहीं अब तो रुक जा बेटा, अब तेरे से कुछ नहीं हो सकता. But so whenever you are tired, your body is not allowing you to do more study, your brain is exhausted, but still some light is coming from your heart. I have to clear my exam. I have to complete such a big syllabus. So these dreams motivate you to do little bit more. So थकान कहती है रुक जाओ, पर सपने फुसफुसाते हैं बस थोड़ा और चल ले, मैं पास ही तो हूँ. Just do a little more hard work. The finishing line is closer to you. The success is very nearer to you. So just 52 days are left for your exam. So you can exert as much as possible. Give every second for your positive studies, for your positive thoughts. Okay, don't be trapped in the negative thoughts or negative lane. Now coming to our third topic, and it is a very commonly asked topic, is identification of epidemiological study. Okay, so read the question carefully before jumping for answer. Study started in December 2025 to correlate association of aniline dye exposure and urinary bladder carcinoma. So first keyword, when we had started the study in December 2025, what we are trying to find out, is there any association of aniline dye exposure and the urinary bladder cancer? Where the past 20-year exposure data of 100 workers were collected from records and concluded that aniline dye exposure is related with high possibility of bladder cancer. Okay, high possibility of the bladder cancer, the correct about study. So here 3 points I try to ask from you. One is try to identify the study. Second is what is the parameter calculated by that study, and the third is interpretation of that parameter. Okay, and I'm very happy, and a big clap for all of you because everybody is answering the correct answer. Not a single student is making mistakes. Now we had started a study here in 2025 December. What we had done, we had gone back 20 years, we gone back, we collected the data from records and then we try to analyze the records and coming forward till this point. So first is, it is your retrospective cohort study. Okay, it is not prospective, because if they say they started in December 2025 and then you had followed them for next 20 years and then seen that how many had developed the bladder cancer, then it will be your prospective cohort, but it is not. We had collected the data from records. Okay, it is not a case control study. Why? Because we had not simply gone back and asked the history of the dye exposure. We had collected the data, okay, from the hospital records, made 2 groups, exposed and non-exposed, those who had been exposed to aniline dye, those who were not exposed to the aniline, and then we had analyzed. So it is not a case control study. So your case control study is out, your cross-sectional ecological study is out, okay. Your prospective cohort is also out. Now, it is a retrospective cohort. The parameter which is calculated is a relative risk. Now, the third is the interpretation of the relative risk. They are saying it is related with the high possibility of the bladder cancer. It means the relative risk baseline is 1. The value for a positive association, it should be more than 1. If it is less than 1, means it is protective. Means aniline dioxide will have a lesser chances of the bladder cancer than the relative risk will be less than 1. So less than 1 is also out, and it is more than 1 relative risk, and the study is a retrospective cohort. Okay. So quickly we'll summarize that how we have to identify the study. Now, if we are going from the cases and the control, we already had the cases and control, we make a 2 groups and simply go back to get the history of the risk factor. It is none other than case control. So keywords are, one group is cases, another group is control, and we are taking history of exposed or exposure. Now, this is what the study we had discussed, started at this point, gone back to the point where they were healthy, collected the data from the records, made the 2 groups, one is exposed with the risk factor, another is non-exposed, analyzing the records coming till the present point who had developed the disease. This is retrospective cohort study. Okay. Then prospective cohort, we are starting at this point, we are making the one group is exposed, another group is non-exposed. Remember here, disease should be absent, and then we are following them for certain period, calling them at a regular interval for checkup, and then finally looking for disease. This is prospective cohort. Now, if you are going forward, but if a person is already having the disease and we are having the 2 groups, both had the disease, but one is we are giving a new drug, and the second is we are not giving any drug, either we are giving a placebo, B complex or the old drug, and then following it is your clinical trials or RCT. Okay. Now, ecological and cross-sectional, it is done at particular point only, but if it is based on primary data, we are examining the individual person, it will be your cross-sectional. If it is based on the secondary data, means we are taking your information from another source, like your information your parents wants to take from your room partner, from your friend, that is what is secondary data. It is your ecological study. Okay. So these are the identification of the various studies, a very commonly asked topic in our exams. Now, these are some pointers. Now, which study is called as incidence study? Incidence is calculated by cohort study. So, cohort study is incidence study. Which study is called as prevalence study? Prevalence is calculated by cross-sectional study. So, it is the cross-sectional prevalence study. Okay. Parameters which are calculated by cohort study, it is incidence, relative risk, attributable, and the population attributable risk. Risk ratio formula, risk ratio is same as relative risk. It is incidence in exposed by incidence in non-exposed. Risk difference, it is attributable risk. Incidence in exposed minus non-exposed by exposed. Population attributable risk, incidence in total minus non-exposed by total. Best epidemiological study. Best epidemiological study is meta-analysis. Best analytical study, it is retrospective cohort. If it is not given, then it is prospective or simple cohort you can also go for. Nested case control study is a type of prospective cohort study. Framingham heart study is also a type of prospective cohort study. Secular trend is which type of epidemic? It is a long-term epidemic. Secondary waves are seen in which epidemic? Secondary waves are seen in common source, multiple exposure epidemic. Yes, beta, I had already told you that annotated PDF will be given at the end. Don't worry. Okay? Because I am saving time, because your time is very crucial, I'm saving your time because if I'm writing, I'll be taking some time. Okay, so I don't want to take much of your time, and we will be discussing here only. And in the end, I'll be giving you the annotated PDF. Don't worry. Confounding error is best corrected by stratified randomization. If it is not in your answer, then you can go over with the randomization. The non-confounding error, it is corrected by matching. Now, study of choice for rare disease, it is your case control study. But study of choice for rare disease with expensive investigations, it is your nested case control study. Okay, so these are some of the important points from our topic of epidemiology. The next question goes for topic screening. In a population of 1,000, 100 are diabetic. Errors समझ में नहीं आते बेटा. Okay, remind me in the end. I'll be explaining the different type of epidemiological errors. Don't worry. In a population of 1,000, 100 are diabetic. A new screening test says positive result in 150 individuals. Out of this, only 50% had confirmed to have the disease. Calculate the percentage of individuals with negative test result with the disease. Negative test result with disease. Now, these are the, I can say, the toughest type of questions, because we are not being given a paper pen and we have to make a table in our mind. Now, first of all, so how we have to approach these type of the questions? First of all, we have to see what they are trying to ask. Now, there are the 4 parameters: sensitivity, specificity, positive, negative, predictive value. Sometimes they can ask a false negative and false positive. So, what they are trying to ask is negative test with the disease. Disease is present but the test is negative. So, means they are asking a false negative percentage. This is the first catch, that they are trying to ask the false negative individuals. Okay. Now, how we have to go with this is that we have to make this 2 by 2 table. Okay. Although this table you have to make in your mind, but for our understanding, I am making this table here. So, how we have to approach, and I'm very happy that you all had started answering. Great. So, first of all, how we have to go step by step. This type of the questions may be taking few seconds more for you. So, you can save this time from your other questions. Now, total population of 1,000. Okay. So, what they are saying is A plus B plus C plus D, it is 1,000 population. Okay. How many are having the disease? 100 individuals are actually diabetic. So, disease is present in total disease individuals are, it is 100. So, obviously, the non-disease individuals will be 900. Okay? Now, what the question says, a new screening test, positive result is in 150 individuals. So, positive test result, it is present in total 150 individuals. Okay? And out of this 150, only 50% had confirmed to have the disease. So, out of this positive test result, only 75 is having the disease. And actually, how many were having the disease? Actually, the disease was present in 100 and only the test is positive in 75. So, obviously, in remaining 25, disease is present but the test is negative. Now, so we got our option A and option C. Okay. Now, what is option B? We had we had A plus B 150. So, 75 are the test positive without the disease, and how many are without the disease? 900. So, 825 are without the disease and with negative test. Now, what they are trying to ask is the negative test with the disease. So, negative test with the disease, how many are having? The negative test with the disease is 25. So, if we calculate in the percentage out of 100, it will be the 25%. So, it is 25 out of 100, it means it is 25% are the individual that is false negative the negative test with positive diseases. So I'm very happy that a little bit tricky, difficult question, difficult language, but still each one of you had answered a correct for this. So big clap for all of you. So a little, we can see the little the praise and the appreciation will boost up your confidence. तो जब भी आप अच्छा काम करो, किसी और कोई और आपको जो है एप्रिशिएट करे या ना करे, आप खुद अपने आप को एप्रिशिएट करो। अरे वाह, आज तो मैंने इतना अच्छा काम किया, आज तो मैंने इतने अच्छे क्वेश्चंस आंसर कर रहा हूँ, आज तो मेरा जो है जीटी में बहुत अच्छा परफॉर्मेंस आया था, आज मैंने एक प्रैक्टिस सेशन क्वेश्चंस करे और उसमें सारे क्वेश्चंस मेरे करेक्ट थे, मैंने टॉपिक रिवाइज किया, मेरे को सारे पॉइंट्स याद थे। तो अपने आप को भी जो है थोड़ा सा जो बूस्ट अप करने की कोशिश, अरे वाह मैं तो सबसे अच्छा हूँ, ठीक है। तो अपने आप को भी जब आप प्रेस करोगे, अप्रिशिएट करोगे, सो डेफिनेटली इट इज गोइंग टू बूस्ट अप योर प्रिपरेशन। एंड इट इज सेड, जैसे कहते हैं ना कि कोई दूसरा आपकी तारीफ करता है, सो व्हाई यू फील हैप्पी, बिकॉज सेरोटोनिन इज इंक्रीज्ड एंड इट इज अ हैप्पी हार्मोन। तो कोई दूसरा करे या ना करे, क्या इंतजार करना दूसरे का, खुद ही अपने आप अपनी तारीफ कर लो, ठीक है। सो अपनी तारीफ करो, देखो मैंने कितना अच्छा आंसर करा है। एंड यस, द करेक्ट आंसर फॉर दिस इज, it is 25%. Now coming to the one-liner or pointers from screening, the cost-effective screening test for cancer cervix. Now the question is cost-effective. So cost-effective is via, and Billy, single best answer is via. The cost-effective screening test for cancer breast is self-breast examination. Now best screening test for cancer cervix is pap smear. The best screening test for cancer breast, depending upon the age, if it is 40 plus, it is your mammogram, but if it is less than 40, the best is MRI. If it is not in your answer, you can go with the breast ultrasound. Now, screening test for cancer cervix at the PSC, it is definitely a via. Okay, screening test for cancer cervix at the district hospital, we can go with pap smear. Chemical used for via, 3 to 5% freshly prepared acetic acid. Now, chemical used for Willi, it is Lugol's iodine. So, read the question very carefully, because these will be the buzzwords, which is a cost effective, which is the best, which is at what center we are doing, which is for the screening, which is for diagnosis. Okay? Now, changes in prevalence of a disease is affecting which parameter? Prevalence is affecting the predictive value. If prevalence is high, the positive predictive value increases and the negative predictive value is decreasing. Okay? Time interval between the first possible diagnosis and usual time of disease symptoms, it is called as lead time. The most important quality of a screening test, it is sensitivity. Okay? Highly sensitive tests we are using for screening, and highly specific we are using for confirmation. Now, diagnostic power of a screening test, it depends upon the 3 parameters: the test sensitivity, test specificity, and the disease prevalence. High false positive result in a test could be because of the 2 reasons: either the test is highly sensitive or the disease prevalence is low. But if a same test is applied in the 2 areas and still high false positive, then only the disease prevalence will be effective. Okay? Because the test sensitivity, it is same in the different locations. Now, effect on parameter, if the test is applied in series. If you are applying the test in series, means one test, those positive, we apply the second test. The purpose is that our positive predictive value should be high and specificity of the result should be high. So, any person with a positive test should definitely have the disease, and any person who is healthy should be out of the disease. Always remember with HIV, what I always tell you, that in the HIV, first we apply ELISA, and those who are ELISA positive, we apply the Western blot. Okay, this is what is test in series. To make a test highly specific, keep the cutoff towards upper side. To make a test highly sensitive, keep the cutoff towards lower side. Now, Kaplan-Meier curve is used for survival analysis. Now, ROC, receiver operator curve, is plotted between the true positivity and false positivity. Okay, this is to know which is the test which can be used for screening, which is the best test, should be having more of a true positive and the less of false positive. Okay, we know that everybody want success in the exam, and I am praying from my bottom of heart that each one of you should pass in this exam. But it demands certain the golden rules. You all had passion to become a doctor. That's why you were chosen this branch. You had studied in your MBBS with full discipline. You had focus, like on the day of your entrance in the university, you were knowing that after completing your MBBS, you have to give this FMG exam to get a license for practicing in India. And you are working hard, not only for past few months, you are working hard since last few years. And these are the pillars for your success, and no doubt about that you all are working on these pillars. So definitely no one can stop you from getting success in the upcoming examination. Okay. मुकेश भाई, अब पेरेंट के प्रेशर से लिया या अपने मन से लिया, वो पुरानी बात हो गई, ठीक है, भूल जाओ उसको. आपने ले लिया ना, अब ले लिया है, नाउ यू आर इन दिस फील्ड, तो यू हैव टू फॉलो द रूल्स ऑफ दिस फील्ड. ठीक है, किसी के भी प्रेशर से लिया, मन से लिया, प्रेशर से लिया, अब वो पुरानी बात हो गई. ठीक है, नाउ यू आर इन दिस फील्ड, सो यू आर फॉलोइंग द पाथ, you are exerting, you are working hard, and definitely you will get success. And अभी आपको लग रहा है बच्चे, लेकिन जब आप फ्यूचर में you'll be a big shot, big doctors, and when patients will bless you, तो वो आपको जो एक इंटरनल फीलिंग होती है, वो खुशी आपको किसी भी और चीज से नहीं मिल सकती. Because still the doctors are considered as second to God on earth. वो कहते हैं भगवान तो हमने देखा नहीं है, लेकिन आप भगवान के रूप में हमें दिखते हैं. जब आप किसी रिलेटिव्स की उनके जान बचाते हैं, तो आप उनके लिए तो भगवान ही है. तो वो दिन भी आएगा जब आपको प्यारी प्यारी ब्लेसिंग्स मिलेंगी, और वो जो खुशी आप फील करोगे, वो खुशी आपको दुनिया की किसी चीज से नहीं मिल सकती. ठीक है बेटा, तो परेशान होने की जरूरत नहीं है. You are chosen a good path, and your parents are understanding better than you. Now coming to the next question, it is from demography, a most commonly asked topic in our exam. Incorrect matches. So what is the incorrect match? Read the question carefully. Incorrect match. Sex ratio, it is female per 1000 male. Okay, it is a population indicator. Yes, it is a true statement. Dependency ratio, it is non-working to working population. It is a vital indicator. No, vital means there are the two type of indicators. Vital means that something related to birth and death. यहाँ पे birth and death से कुछ नहीं है. So this is a population indicator, so it is your false statement. TFR, total fertility rate, completed family size, or total number of the children born to a woman in her entire life, it is a vital indicator. Yes, it is a true statement. ठीक है? So TFR is also a true statement. Remember beta, those who are answering option C, it is not correct. My question is, which is a incorrect match. Okay, GFR is general fertility rate. It is live births per 1000 reproductive female. So it is also correct, and it is a vital indicator. It is also a true statement. Okay? So we should be knowing what are the population indicators very commonly asked from us. So there the demographic indicators are divided into the two groups. So wherever the groups are there, the question is asked, and it is one of the old FMG question is also that all are the vital indicators except the demographic, and all are the population indicators. So vital means where there is a life and birth is happening. Okay, so crude birth rate, crude death rate, general fertility, total fertility, gross reproduction, net reproduction. These are the vital indicators. And where we are just discussing some features of this population, the number is constant, that is the sex ratio, literacy rate, dependency ratio and population density. These are the population indicators. Okay? So, be very careful about that what are the vital indicators, what are the population indicators, about their definitions, very commonly asked in the exam. So, coming to important pointers of this demographic topic, most important demographic parameter. The most important demographic parameter is NRR or net reproduction rate. Now, demographic population indicators we had already discussed. It is the sex ratio, literacy rate, dependency ratio and population density. Now, current doubling time of India. Now, doubling time is actually the 70 divided by the growth rate. And current, if I say the crude birth rate of India is around 18.4 and the crude death rate of India, it is around 6.4. So, current growth rate of India, it is 1.2%, okay? Because growth rate is birth rate minus death rate divided by 10. So, it is 1.2. So, we can see the current doubling time of India, it is around 47 to 70 years, okay? 47 to 70 years. So, here remember the question that if they ask us the doubling time as per the last census which happened in 2011, at that time our in the 2011 census, our the growth rate of India was 1.6%. Okay, at that time we used to say the doubling time was 35 to 47 years. Okay, because the different slots are given. Like if it is a growth rate is 0.5 to 1%, what is the doubling time? 1 to 1.5%, 1.5 to 2%. Remember like this. Okay, so see the question carefully. They are saying the current doubling time, it is 47 to 70 years because our current growth rate is 1.2%. Now, for NRR to 1, what should be the TFR? For NRR to 1, the TFR should be, no beta, 1.9 TFR is the current TFR. But for NRR to 1, the ideal TFR should be 2.1. ठीक है, 2.1 होना चाहिए, although we had a current TFR of 1.9. ठीक है. Now, eligible couple register is maintained by which worker? Multipurpose worker female, where she is posted at subcenter. Now, sex ratio definition, it is number of the female per 1000 male is your sex ratio. Denominator in the literacy rate. Literacy rate mein we don't take a total population. It is 7 years or more because these are the people who are able to read, write and understand. Now, denominator in the dependency ratio, denominator down is the working population. What is the working? 15 to 65 years. Numerator in the dependency ratio is the non-working population, that is less than 15 years or more than 65 years. Yes, beta, the ANM, it is Mukesh beta, it is parallel to multipurpose worker female. Multipurpose worker female is posted in the rural subcenters, while ANM is their counterpart, is posted in the urban subcenters which are called as health and wellness centers. Okay? Preferred method in the census for data collection is, it is the de jure. De jure means your place of your permanent address, okay, and de facto is your place of working. So, we are taking where you are having your permanent address registration as per your Aadhaar card or other documentation. So, these are some of the important points about the demographic indicators. Now, another important area of demographic is the phases of the demographic cycle, okay, and from here again repeatedly questions are asked. Identify the phase of demographic cycle and relationship of marked arrows. Now, this is the graph which is also known as demographic transition. Demographic transition. So, first of all, you have to identify the phase. Then you have to say, because this upper line, it is corresponding to the crude birth rate, and the lower line is corresponding to the crude death rate. Okay. Now, this is our first phase, that is high stationary phase. Here birth rate is very high, the death rate is high, and the gap between this is called as demographic gap is constant. So, population is constant. Then in the phase 2, that is early expansion phase, that is birth rate is very high, but death starts suddenly declining and demographic gap starts increasing in the beginning of the phase 2. It is maximum towards an end of the phase 2. Okay. So this is actually, you have all had started answering quite correct, that this is your early expansion phase. And now early expansion phase may be, the two choices are there, the birth rate is more than the death rate or birth rate is less than the death rate. So obviously this is the birth rate which is more than the death rate. So option B is the correct answer for this. It is an early expansion phase. Okay, early expansion phase, and below one is the so beta, a red line, this is actually the red arrow, it is pointing towards your birth rate, and this is a purplish arrow, it is pointing towards your death rate. Okay? So it is your early expansion phase. Now we are having the phase number 3, or the late expansion phase. It is important because India is in this demographic phase where we had decline in the birth rate with the contraceptives, continuing the decline in the death rate with the medical facilities. Population is increasing but at a slower rate. Then it is the phase 4, that is the low stationary, the low birth, low rate, population stationary, and the phase 4 is the reversal where birth is almost zero and natural death is happening. So this is your beta high stationary. It is not a high stationary because birth and death rate are not parallel. So this is not an high stationary because birth rate and death rate is equal. No, it is a phase 1, that is what is high stationary. Okay, it is not a phase 1, it is a phase 2. Now early expansion, yes, it could be either B or C. So early expansion may, because here the birth rate, it is more than the death rate. So birth rate is more than the death rate, that is the correct answer, because birth rate less than the death rate, it is not the correct answer. Okay, and the late expansion, it is again the late expansion, not the late expansion, because this is the phase 3 late expansion where birth rate is declining. Okay, birth rate is declining and they are asking for this marked arrow phases, that is the phase 2. So it is not a late expansion phase. Okay, so that's why the other answer are not the correct answer. Now coming to pointers for this demographic transition, the correct demographic phase of India. India is in phase 3 or late expansion phase. High birth rate is in which phase of the demographic cycle? We had in phase 1 and phase 2, both we had high birth rate. Now stationary population is in which phase of the demographic cycle? Stationary population in phase 1 and phase 4, both are stationary population. Frequency of census every 10 years. The National Family Health Survey every 5 years, and the sample registration survey every 6 monthly. This survey is called as a dual survey. SRS survey is called as dual survey. Okay? We are having continuous recording of birth and deaths, as well as we are having 6 monthly the survey by independent officer. Ministry of Census is Home Ministry. Next census of India is due in 2027. So 00R of 1st March 2027, we will be counting the total population, although in the icebound area, in the states and the districts, it will be conducted in October this year. Okay, like in parts of Jammu Kashmir, parts of Uttarakhand, then Leh and Ladakh, it will be conducted in October 2026 because it will not be possible in February. While in rest of the states, it will be in February, and the final counting will be on 00R of 1st of March 2027. We all will be the eyewitness for that census counting. Birth and death registration in India, it should be done within 3 weeks or 21 days. Now, which worker is responsibility for birth and death registration in a village? It is ASHA worker which is responsible. Now, base of the population pyramid, the base is representing fertility. Okay, so base is representing the fertility, the height is representing the life expectancy, and the symmetry, it is representing sex ratio. It is a double histogram is there. Now, ideal TFR or NRR for population stabilization. Now, for the population stabilization, the NRR should be 1, and for that the TFR should be 2.1. If this is this, then we are having the population stabilization. Okay. So these are some of the important points from this demographic transition and its phases. We all are working very hard, but sometimes we put a question mark for our ability. क्या मैं कर पाऊंगा? क्या मैं इतनी मेहनत कर रहा हूं? जो मैं पढ़ रहा हूं, क्या वो एग्जाम में आएगा? क्या मैं एग्जाम में याद रख पाऊंगा? So we always put a question mark on our abilities. So beta, always try to have a self-confidence. If you're working with honesty, it means you're working hard and definitely it is going to pay for you in the form of good result or good marks in the examination. So have a confidence on your hard work and definitely it is going to pay you. Next is again a very important contraceptive, that is IUCDs and OCTs. Very commonly asked question from this. This is a clinical scenario. Now, in the clinical scenario, with an image, if it is given, so in this case, if you could see, it is an X-ray pelvis. And X-ray pelvis mein, the one abnormality what you could see is, this is image. And this image is, it is a inverted T-like structure. And this is nothing but it is your copper T. Okay? We know that copper T we are putting in uterus. And where is the uterus? It is in the pelvis. So in a normal situation, I could see the copper T somewhere here. Now it is not in the pelvis, it is going out of the uterus, somewhere in the upper part of abdomen. What means? That there is displacement of this copper T. Okay? So if an image you could understand, and if you try to read the last line or the last two lines, the question is that with the given investigation findings, the next step is, now if I am not going to read the whole of this, the stupid story, even I can answer with this image, copper T is displaced in the abdomen. I have to remove by none other procedure but by laparoscopy. Okay? So without reading this whole story, I am getting my answer. This is what is the smart application of your knowledge in the examination to save your time. Okay? So 28 year now, for our satisfaction, we should read the question because I made the question with the great efforts. तो थोड़ा सा उस efforts के लिए time तो दे दे, पढ़ तो लें क्या है. 28-year female, Mrs. Sharma, reported to the medical emergency unit with complaint of severe vomiting and pain in the lower abdomen. Since last 2 days, she is giving the history of copper IUCD insertion. Okay? So a very important keyword is that copper T is inserted. At the nearest subcenter, 6 months back, on examination, the tachycardia, pulse is 115, temperature is 40 degrees Celsius, hyperpyrexia, tenderness in the lower abdomen, some infection because temperature bhi zyada hai and pulse bhi zyada hai. So this is a case something related to the PID. And on the perispeculum examination, the IUCD thread is not visible. This is again a very important keyword. IUCD insertion की history है, लेकिन perispeculum examination में thread is not visible. If the thread is visible, it means the device is in place inside the uterus. And this is the investigation done, that is an X-ray, and we find that copper T is displaced, it is outside the uterus. So copper T is displaced outside the uterus. There is some infection in the uterus also because it is perforating the uterus, as well as it is causing infection in the abdominal cavity. Because of that, there is a tenderness and tachycardia and high temperature. So removal by laparoscopy. Okay? So this is how we have to proceed for the question with the image So 90% time with the image and the last two lines you can get your answer. And this is the smartly you have to save your time with the for the big clinical questions. Okay. Now coming to different IUCDs, these are very commonly asked as an image based questions because already been asked as a previous PYQs also. The loop like structure, this is your Lippes loop, it is your Lippes loop. The ring like structure, it is your Grafenberg ring. It is your Grafenberg ring, and these are the first generation devices not used nowadays. Now this is a T-like structure with a thread hanging. It is your copper T, and if the copper thread is both the arms, it is your copper T 380A. Now copper, it is present with thread hanging, but it is not like a T structure, it is like a shape of the uterine cavity. It is your multi-load 375. Okay, these numbers are representing the amount of copper. If you just remove the copper, the area is in the square millimeter, it is the number. Now if you could see here is, that is a thread is hanging in the vagina, T-like structure but no copper, but a capsule is seen. It is having hormone, and it is your Mirena, which is a brand name, or it is also known as LNG20. Okay, Mirena or LNG20. Now we are having, so this hormonal are the third generation devices, copper are the second generation devices, and the fourth generation devices we are having the frameless, means either the copper or hormone is only present on a thread. So if it is copper, then it is a flexi guard, it is copper on a thread, and this is just hooked inside the myometrium. And if it is a capsule like structure, it is present on a thread, and it is your hormonal fourth generation device, that is fibroplant. Okay, but in our exam commonly what we are asking is the second generation devices as multi-load or copper T 380A. Both are available free of the cost in our government centers. Now some investigations about the IUCDs, because these IUCDs, especially the copper one, they are containing barium sulfate, and barium sulfate is visible on X-ray as well as on ultrasound also. So sometimes they could be giving you other images also, because this is also one of the related PYQ. Now this is your ultrasound image, longitudinal section, this is a transverse section, and in the longitudinal section in the center you are seeing this radio opaque shadow, and this is your copper T, and in the transverse section you could see this T-like structure, it is your copper T. Now this is ultrasound, this is an anterior wall of uterus, posterior wall of the uterus, longitudinal section, this is your endometrial cavity, and this IUCD, it is partially displaced inside the myometrium. So if this is the image, then we have to remove with hysteroscopy, because it is inside the uterus. Even if a thread is visible, if a thread is visible and it is a normally placed, you can just pull the device and by pulling the thread. But if it is displaced, then don't pull, because if you are just blindly pulling, it can damage the muscle. Okay, so under the hysteroscopic guided, we have to remove even if a thread is visible, but the device is, it is displaced. Okay, this is the X-ray, and in this X-ray normally the device should be here in the pelvis. Now it is rotated by the 90-degree and it is seen in upper part of the lower pelvis, or in the lower part of upper abdomen. Now this is the device where you could see a capsule like structure. So this is none other than your Mirena. Okay, and this is what is the gestational sac. It is the gestational sac, and in the center there is a yolk sac. So it is a pregnancy along with the copper T. So it is failure of the device where the person is pregnant with IUCD in place. So these could be the different images can be asked as a clinical question. Now coming to pointers for IUCDs and other contraceptives, the best time for IUCD insertion, we have to exclude the pregnancy from the previous cycle. So the best time we say post menstrual, after the periods. Or we can say the post-pubertal, means 6 weeks after the delivery, or post-abortion, after abortion we can put the device. But a preferred time in our national program, because patient is motivated and we want to catch the patient just after the delivery, and preferred time for IUCD insertion as per the program is PP-IUCD, postpartum IUCD insertion just after the delivery within the next 48 hours. Okay. The most common side effect after IUCD insertion is menstrual irregularity. Patient can have either menorrhagia, metrorrhagia, polymenorrhea. The most important contraindication for ICD is existing infection, PID. In the presence of PID, we are not putting foreign bodies. The best method of contraceptive for birth spacing, it is IUCD. The best method of contraceptive for delay in the first baby in recently married couple. Recently married couple, we want to delay the first baby. The best is, it is OCPs. The best method of contraceptive for young adolescents, because there is a risk of multiple partners, it is barrier methods, condoms. Removal method of IUCD, if it is inside the uterus, then it is, if a normally placed thread is visible, simply pull the thread. But if it is displaced, then we have to remove with hysteroscopy. Daily release of LNG in Mirena. It is called as a LNG 20. So it is 20 microgram of LNG, levonorgestrel, is released per day. Can this IUCD can be used up to how many days after the sexual exposure as an emergency contraceptive? It can be used up till 5 days after unprotected sexual intercourse as emergency contraceptives. Coming to next question about hormonal contraceptives. Okay. Now this is an image which is given and incorrect about the image. Incorrect about the image. So just try to read the choices. Okay. Now first of all, see the image. It is Implanon, that is a single rod implant. Single rod implant, it is a long acting hormonal contraceptive. It is a long acting reversible contraceptive. Yes, very true, because this single rod implant is acting for 3 years, and after 3 years you can remove this empty rod and then patient can conceive. So it is a reversible. Safely used by the lactating woman. Yes, because it is containing progesterone and it is safely used by the lactating woman. Contraindicated in lactating women. No, it is a false statement, and you all are answering the correct. Okay, so big clap for all of you. And single rod implant, which is effective for 3 years, it is also true. So incorrect statement and answer for this question is option number C. Now, if we talk about other hormonal contraceptives, one formulation is oral, and free of the cost available in our government center is Mala N. And Mala N May, we are having the 28 tablets, but always remember the 21 tablets are the same shape, size and color. These are the hormonal tablets, and these remaining 7 are the iron tablets. Okay, but if all these tablets we are having of same shape, size and color, the 28 tablets, then it is your the progesterone only pills. Okay, so progesterone only pills we are having the 28 tablets, because continuously we are giving without any break. The very commonly asked question here is that which tablet is safe in lactating women. So progesterone only pills are advised, where OCPs are contraindicated. The hormonal preparation which is available the free of the cost, it is the injection form. It is DMP injection, which is given the name as Anthra injection. Every 3 monthly it is given by intramuscular. The vaginal rings and skin patches, they are little expensive, so not very commonly used, but containing estrogen and progesterone, so they are only used for 21 days. So on the 5th day, patient puts this ring, and after 21 days, patient removes herself, she will have a withdrawal. Now skin patch, a set of 3 patches, one patch is lasting for 7 days. So total 21 days, estrogen and progesterone is there. Okay, again after 3 patches, they have to wait for withdrawal. Then again in the next cycle, they can put. These are the implants. Earlier we used to have the 6 rod, that is now plant 6. Then we had a 2 rod, now plant 2, not preferred by the or accepted by the community, and now we are having the single rod implant, that is Implanon or Nexplanon. It is now recommended. Okay. Now coming to how many MCQs are coming from PSM beta? It is one of the major subject, and as per the guidelines, minimum 30 questions. But what we had seen in past exams, 35 to 40 questions are asked from the community medicine. So it is having a very important weightage for our exams. Some of the pointers from a contraceptive: the name of the implant for परमानेंट कॉन्ट्रासेप्शन, परमानेंट कॉन्ट्रासेप्शन के लिए जो इम्प्लांट यूज करते हैं दैट इज कॉल्ड एज एश्योर इम्प्लांट. ओके. Pearl index for Implanon, it is very effective. Lowest Pearl index is 0.1 only, similar to the vasectomy or tubectomy. Name of the hormonal injection is in the family planning program, it is Antara, that is DMP injection. Name given to non-hormonal oral tablets is Chaya tablets, that is Centroman tablets, which is available in the market by the name of Saheli. Okay. Composition of hormonal tablets in Mala N: estrogen is 30 microgram ethinyl estradiol and 150 microgram of levonorgestrel. Remember, micrograms. Okay. Composition of iron tablets, tablets in Mala N: it is having elemental iron as 19.5 milligram in the form of 60 milligram of ferrous fumarate. Now, no confusion, what iron folic acid tablet we are giving in pregnancy, lactation, or under the Anemia Mukt Bharat program as a prophylaxis, it is usually containing 60 milligram of elemental iron, okay, in the form of either 300 milligram of ferrous fumarate or 200 milligram of ferrous sulfate. Cancer increase with the use of Mala N. Very commonly asked question: increase or decrease? See the question carefully. Cancer increased is, that is the breast cancer, the cervix cancer, and the benign hepatocellular adenomas. And the cancer reduced is the reduced risk of endometrial cancers, ovary cancers, and the colorectal cancers. Okay. Now UPT kit known as Nishchay. Okay. Nishchay means you have to decide after going for a urine test whether you want to continue or you have to abort. Important advice given to couple after vasectomy surgery is the use of 3-month barrier methods, especially the condoms. Preferred emergency contraceptives is a single dose 1.5 milligram LNG tablet. The best emergency contraceptive is IUCD to be inserted within 5 days and LNG tablet to be taken within 72 hours. Non-hormonal long-acting reversible contraceptives. Non-hormonal long-acting means more than 1 month, it is your IUCDs. Failure in 1200 months of use is used for calculation of Pearl index. Preferred method of tubectomy in the postpartum phase. Postpartum phase mein you can not go for laparoscopy, you are going for mini laparotomy, and in that we are going for with the modified Pomeroy's method where the double ligature we are using and using the absorbable thread, either the catgut or chromic catgut, not the thread or silk. We know that for study we make a plan. You are working with your plan, but sometimes you see that you are not scoring the desired marks in your test. So in that case, you have to work on your plan. So you have to change your plan, change your strategy, not the goal. The goal is ultimate that you have to clear the exam. ऐसा नहीं कि यार पढ़ रहा हूँ मैं इतना पास मार्क्स ही नहीं आ रहे, चल छोड़ यार मेरे को नहीं देना एग्जाम. No, you cannot change your goal. Your goal is you have to appear with the confidence in the exam on 28th of June and you are going to get a good marks in the exam. So if your current plan is not working, you can change your plan, you can make your another strategy to get a effective marks in the exam. In response to high malaria cases, health team is on high alert, the regular active surveillance for case finding and treatment, but no measure is taken for the mosquito control and insecticidal spray, use of the Gambusia fishes, distribution of the mosquito nets, which principle of the primary health care is compromised. So here we are having the 4 principles of the primary health care. Community participation. It means that the voluntary community people should involve. It is not compromised here. Equitable distribution services should be available equally to all community members. It is also not compromised. Intersectorial coordination, it is compromised because doctor is working. What they are doing, they are finding their cases or health worker and they are treating. This is what is the health department job. But there is a job of the other CPWD department that they are just putting the Gambusia fishes, they are doing the insecticidal spray, trying to control the mosquito breeding, but they are not working properly. So intersectorial coordination, it is compromised. Appropriate technology, we are having good technology to diagnose and the treat, so it is also not compromised. So the compromised component or the principle of the primary healthcare is intersectorial coordination. So in the exam, don't have a confusion in the elements and the principle. Elements are the services what we are giving under the primary healthcare and the 8 facilities we are giving, and the principles means to whom we are giving, how we are giving, and to whom we are involving in that. That is what is the principle. Okay. So elements of the primary healthcare, we know that 8 elements are there. Now, what is the population coverage? Again, very commonly asked question in the exam, that we should be knowing the population coverage of the centers and the workers. Now, NRHM is a National Rural Health Mission. It is for a population less than 50,000. If it is 50,000 or more, then a component of the health mission which is applicable is the urban health mission. Asha worker, now listen carefully. The proposed is 2 Asha per 1,000 population, but currently we are having 1 Asha per 1,000. So answer for your exam will be 1 Asha per 1,000 till any development is coming. Okay, and if any update will be coming before the exam, I'll be definitely informing you. Now OSHA, it is a counterpart of ASHA in the urban area. It is 1 per 1,000 to 2,500. That is also called as urban ASHAs. ICDS centers 1 per 400 to 800 population. ANMs is a counterpart of multipurpose worker female in urban areas, 1 per the 10,000 population. Multipurpose workers male or female at the sub-center 1 per 5,000. Health assistants male and female, it is at PSC 1 per 30,000. Medical officer at PSC 1 per 30,000. Ophthalmologist as per the National Blindness Control Program, 1 ophthalmologist at Secondary Vision Center 1 per 5 lakh population. Sub-centers 1 per 5,000. Health and wellness centers, it is a counterpart in the urban areas of sub-center 1 per 15 to 20,000 population. PSC 1 per 30,000. Urban PSCs 1 per 50,000. CSCs 1 per 1.2 lakh or 1 lakh average. Urban CSCs in metro 1 per 5 lakh. Urban CSCs non-metro, it is 1 per 2.5 lakhs. All had been asked as a previous PYQs. Okay? Pharmacist 1 per 10,000. Lab technician 1 per 10,000. So 2 to 3 pharmacists and lab technicians at PSC. Microscope is 1 per 25,000, means 1 microscope at PSC. Okay. Now coming to the health workers, again this is a very important area from where again the question is asked is the workers covering 5,000 population and are working under the IDSP project, MNCI program doing well chlorination in villages and child vaccination. The correct about the worker. So worker which is, so यहाँ पे keywords क्या है? It is covering the 5,000 population, that is a population of sub-center. So obviously the worker is posted at the sub-center. Working under the IDSP project is Integrated Disease Surveillance Project. MNCI program is Integrated Management of Newborn and the Childhood Illness and Well Chlorination. So this is the function of multi-purpose worker male. Okay? Multi-purpose worker male. And you all had started answering quite correct. A big clap for all of you. Asha, it is not the worker. Now there is a tie between the multipurpose worker where he is posted. He is posted at the sub-center. So it is not for the village and it is not posted at the PSC. So multi-purpose workers, that is posted at sub-center. Now quickly we'll see the different type of the workers. Now ASHA worker, the main function is to, you know, uh, as a part of JSY scheme, Janni Suraksha Yojana, she is escorting this pregnant patient. This is the pregnant patient, and taking her for admission to hospital for promotion of hospital delivery. And rest of the time, she is working as an educator to community for various activities. Okay? Now, second is your Anganwadi workers. Anganwadi workers are posted in ICDS centers and doing growth monitoring, giving vaccination, distributing midday meal, and working as a non-formal school education. Multi-purpose worker female. Multi-purpose worker female. She is a main worker for all MCH activities. Now she is doing an antenatal checkup, giving the vaccination also, and doing a postnatal care also, postnatal visits. Okay? And multi-purpose worker male are posted at the sub-center. They are dealing with the works other than MCH activity, means treating the patients. Now we are having CHOs, community health officer also. These are actually either the Ayush doctors or trained staff nurses, and they are now treating the patients. And this multipurpose worker male, it is doing the other activities like malaria surveillance or the well chlorination, or they are doing a part of IMCI activities or IDSP project. Okay? So this is a multipurpose worker male. So these are some of the important points about the workers. We know in this journey, we might be having some up downs. Sometimes, if you are not able to perform well, we feel little bit upset. लेकिन मिस्टेक करना गलत नहीं है. मिस्टेक को आइडेंटिफाई करके अगर आपने रेक्टिफाई नहीं किया या उससे कोई लेसन नहीं लिया, वो गलत है. Do the mistake because these are your practice sessions. But whatever the questions you are making wrong, you just note down in a one copy, and you have to read thoroughly those topics, why you are making the mistakes, you have to answer this. Again, then you have to build up your concepts, you have to rectify your mistakes and promise yourself that you are not going to make these mistakes again on your final day, that is on the day of examination. तो हार सिर्फ एक कहानी है, अंत नहीं है. जो इंसान गिरकर फिर उठता है, वही अपनी किस्मत खुद लिखता है. So we have to learn from our mistakes and we have to go for them. And that's why very truly said that forget the failures and keep the lessons. जो आपने गलतियां करी उनको भूल जाओ. Those who might be appearing for the second or the third time in the exam, never have a thought in your mind that this is my third attempt, this is my second attempt. Whatever has been done in the past, you have to learn or take a lesson from the mistakes what you had done in earlier, and you are not going to repeat those mistakes again. Okay, so this is an important point. Now coming to the next question is, again this is a very important program. Under the given program logo, the good MCH care is provided to the community to reduce the maternal and pediatric mortality rates. The incorrect about this program. So first of all, we have to identify this program. This is the logo for the National Health Mission, which is now called as Pradhan Mantri Samagra Swasthya Mission. Okay, National Health Mission ka logo, which is now called as Pradhan Mantri Samagra Swasthya Mission. So what they are trying to ask is, what is the incorrect statement? So read the question very carefully. Okay. Main worker of JSY is Asha, who is given the 600 rupees as an incentive for the home delivery of a lady in the urban low performance states. Now she is given an incentive. In the urban areas, she is not given the 600, she is given the 400. Okay? 600 she is given in the rural areas for both the low and the high performance states. So this is your false statement. 6,000 rupees as an incentive is given to a lady in a single installment after the delivery of the second female baby under the Pradhan Mantri Matru Vandana Yojana. Yes, this is correct. And if it is the first baby, then it is a 5,000 in the two installments. And if it is a second female, then 6,000 as a single installment 14 weeks after the delivery. Institutional delivery with the 5 clean techniques with the use of disposable delivery kits. Yes, this is also the true statement. Prophylactic iron folic acid tablets to every pregnant lady 180 days before to 180 days after the delivery, irrespective of hemoglobin percentage. Yes, it is also a true statement. Okay? So yes, you all are answered correct and incorrect, and that is the answer for this question is option number A. Now these are some important logos of the various program we should be knowing. This is the logo. What we will be given in the exam is only this one. It is a mother and the baby. It is a logo of Pradhan Mantri Matru Vandana Yojana. It is promotion for hospital delivery, especially for primary gravidas. 5,000 rupees in two installments, 3,000 and 2,000. This is your Surakshit Matrata Abhiyan. It is the pregnant patient is protected by the two hands, means a free antenatal checkup by private doctors on 9th of every month. This is the logo for a Suman, that is Surakshit Matratva Ashwasan, means a zero preventable maternal and newborn mortalities. Again, this is a app Ka. It is Ka is Kilkari app. We are having the audio messages. It is not the written messages, text messages, not the video. It's an audio messages every week we are having. Sabla, it is to make a adolescent girl and reproductive female strong. Okay, that is this कहते हैं ना abla nari, weak lady. We have to make that strong. Arman is ichha, advanced reduction in mortality and morbidity in mother and the newborns. So by giving good antenatal care, we can be having reduction in the mortality and morbidity. So all is ultimately purpose is to prevent the maternal mortality, morbidity and neonatal mortality and morbidity. Now some important pointers for this. Number of maternal deaths per 1 lakh live births. Maternal deaths per 1 lakh live births, it is your maternal mortality ratio. But a number of maternal deaths per 1 lakh reproductive female, it is your maternal mortality rate. Okay? If nothing has been mentioned, if a simple MMR is given, then it is to be taken as maternal mortality ratio. Remember this point. Now, verbal autopsy is known as the rhyme method, where we are trying to find the cause of death. The most common cause of MMR is hemorrhage, and in that the postpartum hemorrhage is most common. The SDG goal for MMR, that we have to bring down the MMR to less than 70 per 1 lakh live births by 2030. Minimum antenatal visits 4, minimum postnatal visits are 3. Tests performed at subcenter. Now subcenter pe we can performing hemoglobin percentage, blood sugar, urine albumin sugar. This is to detect gestational diabetes, hypertension in pregnancy by blood sugar, blood pressure, and urine albumin sugar again for diabetes and hypertension, and hemoglobin percentage. Okay? It is for anemia. Starting of iron folic acid tablets, again it is a very commonly repeatedly asked question. Beta, it is not less than 17. It is less than 70. Okay? It should be Mukesh beta, it should be less than 70, not 17. Difference between the ratio and the rate. Ratio hota hai beta when we are comparing the two different things. Like maternal deaths are compared with the live births. The female are compared with the male sex ratio. Dependency ratio when the non-working are compared with the working. So when the numerator is not a part of denominator, that is two different things we are comparing, is called as a ratio. Rate means when numerator is a part of denominator. Like out of the reproductive age group female, how many females are dying in pregnancy? Okay, infant mortality rate, out of the total live births, how many infants are dying? So when the numerator is a part of denominator and it is expressed as 1,000, it is called as a rate. When the numerator is a part of denominator and it is expressed as 100, it is called as the proportion. Okay. वैल्यू भी लिख दो, MMR and upper side blank. Yes beta, I'm not, I say that as I'm not writing here because I'll be giving you the annotated PDF. Okay, the value beta, current value of MMR of India is around 88. Okay, 88 beta. Now start of iron folic acid tablet in pregnancy. Prophylactically, now be very careful in the exam. Prophylactically, we are starting from the 4th month onwards till the next 6 months. That's why we say 180 days before the delivery, and for the next 6 months after the delivery during the absolute lactation phase. So 6 months before or 180 days before the delivery to 180 days after the delivery. And it is once in a day iron tablet what we are giving, 60 milligram elemental iron and 500 microgram of folic acid. But if it is therapeutic, means a patient is anemic, the cutoff for anemia in pregnancy is hemoglobin less than 11 gram. If it is hemoglobin less than 11 gram percent, then we have to give the therapeutic. Therapeutic is started whenever we are diagnosing the patient is having anemia. It means we can be starting from the first trimester also, and it is given twice a day. Okay? If it is a mild to moderate anemia, but if it is a severe anemia, then we have to give injections or maybe the blood transfusions depending upon the gestational age and the hemoglobin percentage. Coming to the next is again a very commonly asked area is, that is which test we are using for comparison of the different groups. So tests used to compare baby birth weight in the two groups of antenatal women, one with proper antenatal care and another is without antenatal care. So first of all, when we have to answer these type of the questions, you have to see which type of the data we are comparing. Now we want to compare the birth weight, and birth weight is what? It is your quantitative data. Okay. Next, we have to see how many groups you are comparing. Now in this we are comparing the two groups. One is that is with the antenatal care, another is without the antenatal care. So these are the two different groups. Okay. So two different groups if you are comparing for their birth weight. So birth weight के लिए we are using the quantitative. Okay. So paired and unpaired test we are using for the quantitative variable. Sign test we are using for qualitative. Chi-square we are using for qualitative. Okay. So these qualitative tests are out. This is the first thing. Now beta, those who are answering as option number B, we are comparing the two different groups. Now here we are comparing the two different groups, so it will not be a paired. It will be a unpaired t-test. Now if you are comparing the same group before and after intervention, like if I say that I am recording the hemoglobin of a community before, and then I am giving an iron folic acid tablet for 3 months, and then I am recording the hemoglobin percentage after 3 months. Then if I am comparing the same group before and after intervention, then I will be using the pair t-test. Okay. So pair t-test is also out here. So those who are answering option number A is the correct, but those who are answering option number B, it is not correct because these are the two different groups. Okay. Now where we are using the sign test? Sign test we are using for the two same groups for quantitative variables, and the chi-square test we are using for the two different groups for qualitative variable, or it is more than two groups. Okay. So sign test we are using for the two paired groups, but for qualitative variable. Chi-square test we are using either the two unpaired or more than two groups for क्वालिटेटिव वेरिएबल। ठीक है। Iron is contraindicated in the first trimester. Beta, iron is not absolutely contraindicated. Now, why we are not giving the prophylactic iron in the first trimester is because patient is normally having the physiological vomiting, and some of the patients after taking iron also had vomiting. So, if a hemoglobin is normal, means above 11, so we are not giving prophylactically in the first trimester. But if a patient is having hemoglobin less than 11 in the first trimester, suppose a patient is having 8 gram or 9 gram hemoglobin, then yes, we can give the iron in the first trimester also. It is not contraindicated. Okay? So, coming to some of the points about the statistic, the best data presentation method for continuous quantitative data, it is your histogram. Now, trends of events over time, it is represented by line chart. Correlation coefficient is calculated by scattered diagram. Range of the correlation coefficient is -1 to +1. We have to remember the three ranges: HDI 0 to 1, PQLI -1 to +1, and the correlation coefficient is -1 to +1. Null hypothesis true, rejected, it is type 1 error. Null hypothesis false, accepted, is type 2 error. Maximum upper limit of the type 1 error 5%. Significant p-value if it is less than 0.05. Best sampling method is stratified randomization. Cluster random sampling is used for immunization survey. Okay. Whenever we go for sleep, we should be making a plan for tomorrow. ऐसा नहीं है कि भाई सुबह उठ के सोच लेंगे क्या पढ़ना है। सुबह उठ के सोचेंगे क्या पढ़ना है तो उसमें आपका 15-20 मिनट्स वेस्ट हो सकते हैं। अगर आपने पहले प्लान बना लिया कि भाई मेरे को सुबह उठ के ये करना है तो आपका टाइम बच जाएगा। सो ऑलवेज वेक अप विद अ पर्पस एंड ए प्लान। पर्पस इज आई हैव टू स्टडी टू क्लियर माय एग्जाम, and for that I had made a strategy that I'll be reading this today. And when you go for sleep, don't go to sleep with some uneasiness, unhappiness. अरे मेरा इतना छूट गया, मैं ये नहीं कर पाया. Just go to sleep with the satisfaction that whatever you had done to best of your capability. If you had made a bigger plan, you were not able to cover up that content, no problem. Whatever is left, you will cover tomorrow. But don't regret for that. If you are honest, you had studied quite well, don't regret for that. Okay? And with this satisfaction, if you are going for sleep, definitely you will be having a sound sleep. Your mind and body will be getting fresh for tomorrow. If you are going with some uneasiness, discomfort, you will not have a sound sleep and it will be affecting your next day performance. So, do your work with honesty, sleep with satisfaction, and get up with a fresh body and fresh mind. Next is again commonly asked area. In a study, hemoglobin percentage was calculated for 500 individuals in a community. Their mean hemoglobin percentage reported as 11 gram percent with a standard deviation of 1 gram percent. Calculate the percentage of individuals having hemoglobin percentage in the range of 10 to 12 gram percent. Now here, first of all, we have to see that this range what they had given is coming in how much of a standard deviation. What is the mean hemoglobin? The mean hemoglobin is 11 gram percent. What is the standard deviation is? It is 1 gram percent. So, the range they had given as 10 to 12 gram. What it shows? That is 1 less and 1 more. So, 1 SD or 1 gram percent less, 1 gram percent more. And what is 1? It is your standard deviation. So, they had given us the range of, this is the range of plus minus of 1 standard deviation, and you all are answering quite correct. A big clap for all of you. And it is none other than 68%. Okay. So be very careful. Either they can be asking the what should be the range of the 68% population, or here they had given the range and they'd ask is how much of the population it is covering. So this is your normal distribution pattern of the Gaussian curve, which is bilaterally symmetrical, and the area coming within plus minus of the one standard deviation is 68% or 68.3, whatever you can remember. Within a plus minus of the 2 SD, it is 95% or 95.4%, and within plus minus of the 3, it is 99.7%. One more question is asked is that what is the relationship between mean, median and mode if it is a normal distribution pattern? It is your mean, median and mode is same. And if it is a skewed deviation or the abnormal distribution pattern, like if it is a right skewed, the long tail is towards your right side. In this, the mean will be maximum, followed by median, then mode. And if it is a left skewed deviation, that is long tail is towards your left side, in that case, the mean will be lowest, followed by the median, and then the mode will be highest. So see the question carefully. It's a normal distribution pattern or abnormal distribution pattern, because this relationship is only applicable for normal distribution. But if they didn't mention anything about it is a normal or abnormal distribution, then think or presume this is a normal distribution pattern. Okay. Now coming to another very important area from where repeatedly the question is asked is, that is our program, and this is a very important logo of our Anemia Mukt Bharat program, okay, or Intensified Iron Plus Initiative. Little bit a tricky question, lengthy question, read the question carefully. Identify the correct match for the guidelines of the given program. This is a program which is called as 6 into 6 into 6 strategy. 6 beneficiaries, 6 intervention and 6 institutional mechanisms. Now here the question is related to the beneficiaries. Okay. So let me see. Anybody has started answering the question? Okay, we'll go. So first of all, we have to see for the beneficiaries. Now there are the 5 beneficiary groups and the 5 is their a mode of intervention, and in out of this the 1 is false. That's why in the choices only the 4 is given. So first quickly recall that what could be. So you had started answering as a B. Now let us see. Okay. Now here what are the beneficiaries is, it is not the 0 to 5 year. Now those who are answering option B, just see carefully, the beneficiary is not the 0 to 5 year. So this is a wrong beneficiary. Beneficiary is 6 months to 5 year. This is the first, because first 6 months is an exclusive breastfeed. This is a little bit a difficult question, but I intentionally put here to just get the signal to your brain that sometimes these type of the questions are also asked, because one question asked in a last exam, if you remember, they had just given that arrange the phases of the planning cycle correctly, and they had given the 5 steps of the cycle in the planning cycle, but in the choices there only the 4 options were there. So we had to exclude one that is not a part of the planning cycle. So extra they had given, and because of that I had framed the question like this. So 0 to 5 year is not a beneficiary. This is out. So my first, which is related to C, it is out. Okay. Now coming to 6 month to 5 year, it is a small baby. We are giving as a syrup. So it is 1 ml syrup which is given twice in a week. So 2C is the correct answer. So any one of this 2C. Now coming to 10 to 19 years. 10 to 19 years is an adolescent. We are giving normal adult dose weekly. So normal adult dose kya hai? It is 60 milligram, 500 microgram folic acid weekly. So this is also weekly, this is also weekly. Now what is the difference is the color of the tablet here, it is not the red color, it is the blue color, it is given for adolescent. So number 3, it is matching to the blue color tablet. So 3 is corresponding to E. So D is, this is not a correct answer. So if I am not going for the 4 and 5th, I got an answer. This is the smart application that you got a 2 correct answers. Now only the one choice is left. If you are not matching the rest of the 2, you will be getting your correct answer. This is how we have to save the time. Still just confirm, pregnancy and lactation में we are giving daily. So daily का खाली एक ही option है, that is red color tablet we are giving daily, and 5 to 9 years में we are giving pink color tablet, and this is given weekly. ठीक है? So the correct answer is option number D, not the option number A, B or C. ठीक है? So I hope you got your answer, and here my purpose was that extra option is given and you have to choose that which one is an extra one, and you have to exclude that. Some important points about this program, and this is again nutrition part is a very important topic, and especially the nutrition related national programs are very commonly asked from us. The most sensitive indicator of iron deficiency anemia is serum ferritin level. Now cutoff level for anemia in the pregnancy is 11 gram %. Iron requirement in the pregnancy, now as per the latest guidelines, it is 27 milligram per day. Iodine requirement in the pregnancy, again as per the latest guidelines, it is 220 microgram per day. RDA value, that is recommended dietary allowance, it is a mean plus 2 standard deviation, so it is covering the demand of 97.5% population. Estimated average requirement EAR, it is covering the need of 50% of the population, so it is not preferred in nutrition. Extra calories required in pregnancy is plus 350, but if they are asked especially in the first trimester, then definitely no extra calories. Now extra calories in the lactation, yes, it is first 6 months 6 hai to 600, and the after 6 months it is plus 520 calories are required. We know that you might be having some distractions. So anything that is making you weak or distracted physically, if you are eating unhealthy food, more of a junk food, more of a sugary item, you will be feeling sleepy. That is making you weak. Intellectually, if you are going for social media, it is affecting your thinking power, retaining power. Spiritually, if anyone is demotivating you, discouraging you, so you have to reject all these activities like a poison. That भाई मुझे नहीं खाना है, तो मेरे लिए जहर है, मैं तो मर जाऊंगा. So avoid unhealthy food, avoid the unhealthy social media platforms, avoid unhealthy circumstances, friends or unhealthy aura around you which is demotivating. ठीक है? Always keep positive aura around you. Another very important area from where the questions are asked is, it is vitamin A prophylaxis and deficiency. Image is showing the bitotic spots. It is a vitamin A deficiency symptom. Oh, sorry, we can say the sign. During the routine checkup of a 14-month baby, so first catch is the age of the baby is 14 months, weight is 9 kgs, at the ICDS center, falling lesions seen over the conjunctiva, which are absolutely preventable. How many doses of the vitamin A this baby must have been received till this age if given as a regular prophylactic supplementation under the UIP guidelines? Now this is a tricky question. I am waiting for your answer. And what I thought, you all are trapped. ठीक है बेटा, सब फंस गए यहाँ पे, सब फंस गए. मेरे बिछाए हुए जाल में सारी मछलियां फंस गईं। अब जाल देख लो क्या है। आई एम नॉट आस्किंग प्रिवेंशन। अब निकिता को हिंट मिल गया। आई एम नॉट आस्किंग ट्रीटमेंट ऑफ दिस बेबी। बेबी 14 मंथ है, 9 केजी वेट है। ऑब्वियसली ट्रीटमेंट के लिए 3 डोजेस देंगे, 2 लाख देंगे, 0, 1 एंड 14 देंगे, ठीक है। लेकिन व्हाट आई एम आस्किंग इज दिस बेबी मस्ट हैव बीन रिसीव्ड how many doses of the vitamin A this baby must have been received till this age as a regular prophylactic supplementation. रेगुलर प्रोफाइलेक्टिक सप्लीमेंटेशन मतलब इस कंडीशन को प्रिवेंट करने के लिए अगर हमें उसको विटामिन ए सप्लीमेंटेशन देना होता तो 14 एज का मंथ का बेबी कितनी डोजेस ले चुका है। सो यहाँ पे आई हैड गिवन यू अ सिनेरियो ऑफ अ डेफिशिएंसी but I am asking prophylaxis. And what is the prophylactic schedule? That we are starting from the 9 to 12 month, I am giving the 1 dose of 1 lakh. ठीक है। अगर इस बेबी को 9 to 12 month में 1 dose मिल गया होता, so baby will not be developing this symptom. So 3 lakh single dose we are giving to the mother after the delivery, and this is protecting the baby till 6 months. And this is the baby's 14 month. So this is also not an answer. Now 1 lakh 3 doses to the baby. If a baby is between 6 to 12 months, then for a treatment we will be giving this. This is also not, because baby is not a 6 to 12 month and we are not asking for the treatment. Okay, 2 lakh international units, yes. If I ask that how you are treating this baby, then this will be the answer. 14 month baby, 9 kg, more than 8 kgs. 2 lakh per doses, 3 doses, 0, 1 and 14, but I am not asking the treatment. What I am asking is that what prophylactic dose I could have given this baby and should have received by this time is single dose of 1 lakh international unit should be received between 9 to 12 month. ठीक है। So this was a trap for all of you. फंसाने के लिए मैंने क्वेश्चन डाला था and फंस गए आप लोग, ठीक है। So what a message is, take home message here is read the language of the question, ठीक है। सिनेरियो कुछ भी दिया हो सकता है, लेकिन लास्ट 2 लाइन्स आर इंपॉर्टेंट, व्हाट दे आर ट्राइंग टू आस्क। अब यहाँ पे केस को देख के उन्होंने प्रोफाइलेक्सिस पूछ लिया, ठीक है। सो be very careful about these type of the clinical questions and the related twist, and we should be having a clear concept about the prophylaxis and the therapeutic, ठीक है। अगर prophylaxis है तो 9 doses, 9 to 12 month में 1 dose 1 lakh, and after 1 year 1 to 5 year 6 monthly 8 doses. At any time baby is less than 8 kgs, that is 1 lakh per dose. At 8 or more, it is 2 lakh per doses. Total 17 lakh we are giving. Therapeutic, it can be given at any point on the diagnosis as soon as possible. No age is related. 3 doses, 0, 1 and 14. And how much we are giving? 0 to 6 month mein, it is 50,000. 6 to 12 month mein, 1 lakh per dose. And the more than 12 month, it is same. Less than 8 kgs, 1 lakh per dose. More than 8 kgs, 2 lakh. हम तो फंस गए अच्छे से, आपको फंसाने के लिए तो मछली का खाना डाला था, ठीक है, और उसमें फंस गए, जाल डाला था, आप लोग फंस गए उसमें, ठीक है। कोई बात नहीं, जैसे मैंने कहा दिस इज अ ट्रायल सेशन, ठीक है। अभी फंस जाओ कोई बात नहीं, अभी तो निकलने का रास्ता है, लेकिन एग्जाम में नहीं फंसना। Another very important area from where the question is repeatedly asked is leprosy. Again, this is the leprosy kit is given. Little bit a lengthy question, but the diseases में lengthy question आता है. A patient with 2 hypopigmented anesthetic patches on the chest with a right-sided thickened nerve and the no muscle weakness in the supplied area presented to you. अब यहाँ पे when you had read this question, first of all quickly see which is a type of leprosy, ठीक है। पॉसीबैसिलरी है या मल्टीबैसिलरी, तो यहाँ पे आपको एक्टिव रिकॉल करना पड़ेगा। एक्टिव रिकॉल के क्या है कि हाउ मेनी आर द हाइपोपिगमेंटेड पैचेस, अगर 1 to 5 हैं तो वो पॉसी है, अगर मोर देन 5 है तो मल्टी है। अब यहाँ पे 2 हाइपोपिगमेंटेड पैचेस हैं, ठीक है, गोइंग टुवर्ड्स अ पॉसी, बट राइट साइडेड थिकन्ड नर्व है। अगर एनी ऑफ वन थिकन्ड नर्व हो जाती है एज पर द न्यू गाइडलाइन, इट इज नाउ द मल्टीबैसिलरी। सो 2 पैचेस के साथ में भी अगर थिकन्ड नर्व है, सो माय केस इज दिस मल्टीबैसिलरी लेप्रोसी, दिस इज द फर्स्ट थिंग, ठीक है। नाउ you had diagnosed this patient as a leprosy and started treating with the given pack. The correct about this case, correct about this case. Now, this is a case of paucibacillary 6-month treatment. No, this is not a case of paucibacillary. So, this my option A is a wrong answer. Okay, it is a case of multibacillary. The 12-month treatment with the 3 drugs we will be giving. Yes, it is a true statement. Undergoing program is the National Leprosy Elimination Program. National Leprosy Elimination Program. Now, you all are answering as the option B. Let us see that is what it is. Now, friends, this is the only program which is a eradication program. It is an eradication program. It is not an elimination program. So, this is your again a false statement. Okay, C is false, B is correct. Now, capsule rifampicin 600 milligram single dose to the close contact of newly detected case as a post exposure prophylaxis. Yes, this is the true statement. Okay, so here only the B and D is correct. So, option D is the correct answer. ठीक है बेटा? So, I can understand you are getting little bit messed up, but don't worry. But so, this is how you have to develop a habit of active recall. Each and every concept you have to see carefully. Okay? So, this is not a leprosy elimination program, it is a eradication program. So, C is also incorrect and it is not a case of paucibacillary. So, B is also incorrect. Okay? Now, just have a word about this pack. This pack is also very important, very commonly asked from us in the examination. This is a 1-month pack, and what we do is on the day 1, we are calling the patient to the center, and under supervision we are giving the medicine. This is your 100 milligram of Dapsone. This is the 3 capsule of clofazimine, total 300 milligram. These are the 2 capsule of rifampicin, that is total of 600 milligram. So, these 3 tablets are given under supervision, means patient should not be having vomiting for at least half an hour. And then we hand over the remaining pack, and the daily patient is taking at home these 2 tablets. Okay, here this is your Dapsone 100 milligram, and this is a small dose of clofazimine 50 milligram patient is taking at home. And the cycle is repeated every monthly for 6 months in the case of paucibacillary, and for 12 months in the cases of multibacillary leprosy. Now, some of the pointers in this is drug used for the treatment of leprosy we had already discussed. Then day 1 pe Dapsone, rifampicin and clofazimine higher doses, and day 2 to day 28 we are using in a smaller doses. Now, features of pauci and multibacillary. Pauci में 1 to 5 skin lesions, no nerve involvement, no smear should be positive. Multi में any of the 1 smear positive or more, any of a nerve thickened or 1 or more, and more than 5 patches, that is multibacillary. Loss of sensation, this is also one of the repeated question. The first is the cold goes, then followed by hot temperature, then touch, and the pain finally goes. The main infrastructure of the leprosy program. The main infrastructure is the set center, survey, education, and the treatment center at PSC. Now, incentive given to the patient for the reconstructive surgery, it is 12,000 rupees we are giving to the patient. Inclusion criteria for the post-exposure rifampicin prophylaxis. Inclusion criteria is that at least must be the exposure of 20 hours per week or more for the continuously 3 months in the past 1 year of a recently detected case. Okay? The most important epidemiological indicator is annual new case detection rate. Okay? So, these are some of the important pointers about leprosy. sometimes we underestimate our potential. अरे यार मेरे तो बस का नहीं है, मैं तो नहीं कर सकता. Everything you can do with your mindset. If you had decided in your brain that I have to do, you will definitely do. You will spare time for that. You will spare energy for that, and you will do. So the potential within you is greater than the obstacles around you. The obstacles may be your physical body challenge, some health related issues, some financial challenge, some your family challenge, but still these obstacles cannot stop you from achieving your goal. Remember these words. If you had the strong willpower, because you are having the great potential inside you. Another very commonly asked program is, it is the tuberculosis program. And we know that we had a National Tuberculosis Elimination Program with the logo, and the slogan is TB हारेगा देश जीतेगा, and we have to make India TB free. ठीक है? Incorrect about the given program. Incorrect about given program. So read the choices carefully for your answer. Investigation of choice in a patient of HIV is CB naught. It is a true statement. MDR TB with HIV, BPAL regime is contraindicated. Now, MDR TB with HIV, the BPL regime is not contraindicated. It is given. It is your false statement. 3-month weekly regimen of INH and rifampicin as the TB preventive therapy. Yes, this is the true statement. 1,000 rupees per month given to all the patients of TB. Irrespective of the socio-economic status, it is also the true statement. So, most of you are answering correct, beta, and that is option number B, it is incorrect. I think those who are answering D, they had read the question that they want a correct statement. Beta, rest 3 are correct. So, incorrect about the given program is only because the BPAL regime in the MDR TB, it is not contraindicated. Beta, this regimen is given for 6 months BPAL regime in the MDR cases, and if it is a drug sensitive, we are giving for 6 months. Okay? Some of the important pointers about the TB program. All sputum samples are checked at the DMC centers, designated microscopy centers, 1 per 1 lakh population. The best test for the diagnosis of the latent TB infection is the IGRA test. But now we are preferring the diagnosis is the CY-TB test. CY-TB test, it is intradermal test. It is having the specificity same as an IGRA, but it is cost effective, lesser cost and easily performed. MDR cases are resistant to the rifampicin and isoniazid. Pre-XDR are resistant to, in addition to rifampicin and isoniazid, they are resistant to fluoroquinolones. XDR cases, pre-XDR drugs plus any one of the group A drugs, that is bedaquiline or linezolid. Treatment for the drug sensitive TB, 6 months, 2 months intensive phase HRZE and 4 months continuous phase HRE. Treatment of MDR TB, it is a BPAL regime for 6 months. After the start of the ATT, sputum become negative in 3 weeks. Follow-up for the drug sensitive TB, if you are doing follow-up at 2, 4 and 6 months. Weight bands in the children and adults, because we are having the single tablet having all the 4 drugs, and the 6 bands in the children, and the weight bands and the 5 weight bands in adults, which is called as an FDC therapy, that is fixed dose combination treatment. It is used in HIV also and the TB. Reporting to the district level for new TB cases by the private doctors, it is every monthly we have to report. Surveillance software, it is NICSHE. Okay, no confusion with the NICSHE. It is NICSHE. NICSHE is the UP ticket. NICSHE is the tuberculosis software surveillance, and the NICUST is leprosy surveillance software. Cash given under the NICSHE Poshan Yojana, we already discussed, is 1,000 rupees per month. So these are some of the important pointers. Another very commonly asked disease is malaria. Okay? Now here, if you see the image, banana shaped gametes are given, and these are none other than for Plasmodium falciparum. Okay? So 32-year female patient with a 10-week pregnancy. So treatment, they are asking about the pregnant patient. This is a first catch, and this pregnancy is also the first trimester. Okay? First trimester, because we have to treat trimester wise. And what is a type of malaria? It is falciparum. Who had returned to Delhi from Manipur after 10 days holiday and presenting to clinic with high grade fever, chills and rigors, severe headache on investigation, diagnosis and given smear. So we have to treat a first trimester pregnancy with falciparum malaria. Okay? Chloroquine, it is given for Plasmodium vivax. Chloroquine with primaquine, it is contraindicated in pregnancy, so we are not using. Quinine, yes, it is given for the falciparum in pregnancy, first trimester. Artemether-lumefantrine combination therapy with a single dose primaquine. Primaquine is contraindicated in pregnancy, and artemether-lumefantrine we are giving in a second and third trimester, not in the first trimester. So here, the correct answer for this is, that is option number C. Okay? Beta, if you are answering as option number D, remember, primaquine, it is contraindicated in pregnancy. She is 10-week pregnant. So we should be knowing that if it is a non-pregnant, then yes, for Vivax, we are giving chloroquine with 14 days primaquine for the Vivax infection. And if it is pregnancy, then chloroquine only in all the trimesters and all the states. But if it is for falciparum, non-pregnant, northeast states may we are giving artemether-lumefantrine, other states may we are giving the artesunate sulfadoxine pyrimethamine, single dose primaquine. Okay? And if it is pregnant, then first trimester may it is quinine, and other trimesters may we are giving the same as non-pregnant state. So this is what we discuss usually in our classes, that the treatment protocol for Vivax and falciparum in the non-pregnant states and in the pregnant states. Okay? Now some important pointers for the malaria. Biological cycle in mosquitoes in malaria, where the parasite undergoing the multiplication also increasing in the number, that is cyclopropagative. The best test for malaria diagnosis is peripheral smear. Two type of smear, thick and thin smear. Antigen detected in the rapid diagnostic test kit, it is the HRP, histidine rich protein, or LDH. But it is only recommended if you are not getting the report of peripheral smear in 24 hours. The drug of choice for treatment of Vivax in malaria, we had already talked about. It is the chloroquine with 14 days primaquine. But in Vivax in pregnancy, only chloroquine. Drug of choice for treatment is falciparum malaria, northeast states ACTL, and other states ACTSP with a single dose primaquine on day 2. But treatment of falciparum in pregnancy, first trimester quinine, and in the other we are using second and third is ACTL or ACTSP. Drug of choice for malaria prophylaxis, depending upon duration of the stay. If it is less than 6 weeks, doxy, which is given daily, and if it is more than 6 weeks, then weekly chloroquine or mefloquine. But if it is a pregnancy, then whatever is the duration of stay, we are only giving chloroquine. Okay? How long to continue chemoprophylaxis after leaving the area? For 4 weeks. Then indicator of active malaria transmission is the API, that is annual parasite incidence. Okay? We know that this journey is quite long, exhaustive, but only keep a one golden rule in your mind: never stop trying. कहते हैं ना, कोशिश करने वालों की कभी हार नहीं होती. So never stop trying, never stop believing in yourself, never give up. Very soon the day is going to come when you are achieving all your goals. Okay, the good days are just about to come. Another very important disease and commonly asked question is from AIDS control program. This is the logo for our program. So correct about the National AIDS Control Program. Grey kit, it is anorectal discharge. Earlier we were having the grey color kit used for urethral discharge, cervix discharge and anorectal. But now anorectal discharge has been shifted to the kit number 8, brown color kit. So this is your false statement. Investigation of the choice in a 8-week-old baby to check for mother to child transmission is RT-PCR, because the baby is in window period. So yes, it is a true statement. It is a true statement. ART treatment is started after the diagnosis only if the CD4 count is less than 500. No. Now we are starting as soon as on the diagnosis, irrespective of the CD4 count. So this is also a false statement. So till now only the B statement is correct. Known case of HIV positive, but started taking the ART treatment only 15 days before. Then newborn prophylaxis is with 6 weeks, nevirapine and zoravodine. Only 15 days before, so this is a high risk case. High risk case में आपको 2 ड्रग देनी है, nevirapine and zoravodine. And if it is on the top feed, then it is for 6 weeks only. So this is also your correct option. So B and D are correct, and you all are answering quite correct. That is B and D. That is option number C is the correct answer. Okay. Now, mother to child transmission prevention. This is an important area, and here repeatedly the question has been asked in FMGE also, in the NEET PG also, INSET also. So just we'll be talking a few words about this. That first of all we have to see whether the mother is on the ART or not. If a mother is taking the ART, or if it is not taking, or mother if it is taking, whether they has taken for a sufficient duration or insufficient duration. Sufficient duration means taken more than 4 months before the delivery. In that case, we are giving usually the nevirapine only, single drug, because mother is a low risk, for the 6 weeks irrespective of the breastfeeding. But if the mother has taken for insufficient duration or the less than 15 weeks, or had not taken any medicine at all, mother is a high risk case. In that case, there is a higher risk of transmission, and we are giving the nevirapine and zoravodine depending upon the duration of the breastfeeding. If it is a top feed baby, then it is for 6 weeks. But if it is a breastfeed baby, then minimum about for 12 weeks, but it can be going up to 6 months. Okay? So if you are giving this prophylaxis to the mother and the baby, then the risk of mother to child transmission will be less than 1%. Without any drug to mother and the baby, the risk of transmission is 30%. Can you tell about the TB latest drug regime? Beta, जो TB latest drug regime है, which is given by the WHO, where we are including the moxifloxacin, and it is for a shorter duration, but especially for the drug sensitive. But it has not been accepted by the government of India. Okay? So answer For the exam will be the regimen what is accepted by the government of India, and will going with the old regime only. Okay, so no confusion about that. Yes beta, these are the weeks, 6 weeks or 12 weeks or up to 6 months. It is not the month. Okay, it is the weeks only. Some important pointers about the HIV. Suraksha clinics gives the services for sexually transmitted infections. Grey, green, yellow and the brown color kit very commonly asked kits are. बेटा these are the weeks हैं. Confusion नहीं होना चाहिए. These are the weeks only. These are not the months. This is prophylaxis what we are giving to the baby after the delivery of an HIV positive mother. ठीक है? So this is for the weeks only. It is not the month. No confusion for the months. ठीक है? It is only for the weeks. Now grey kit, it is used for urethral and the cervix discharge. Green color kit is used for vaginal. Yellow color kit is used for lower abdominal pain, and the brown color kit is used for the anorectal discharge. Now surveillance method for STD is the sentinel surveillance. Beta no break, within next 10-15 minutes we are going to wind up the session. Okay? Then best test in the window period is RT-PCR test. Mother to child transmission of HIV without the treatment is 30%, but mother to child transmission with treatment is only less than 1%. The best test for HIV confirmation in India is the Western blot test. Okay? Now another area from where the question is asked is rabies prophylaxis. Okay? So 35-year male who is on ART treatment for the past 2 years daily goes for morning walk. One day while walking, street dog jump on him. So first keyword is patient is an HIV case on ART treatment. Then jump on him, but he had only the minor scratches without any blood. What to do next? So in these type of the questions, yes beta, I already told you that I'll be sharing this PDF, don't worry. And I'll be giving the annotated PDF where all these pointers will be answered. Okay? Now first of all, we have to identify the grade. Which is this grade is? It is the grade 2. We had discussed the grade 1 में one action, only the wound care. The grade 2, it is the 2 action, the wound care plus vaccine. Grade 3, the 3 action, that is the wound care, vaccine and immunoglobulin. Now just I am waiting for your answer. What you will be advising? What will be the correct answer for this? Option B, option C. Okay. Now, again you all are trapped. Although this is a grade 2 wound, but we discussed in our live classes also that if a patient is HIV, agar patient HIV ka hai, so always treat the grade 2 as grade 3 because patient is having the poor immunity. Okay, patient is having the poor immunity. So always treat the grade 2 patient as a grade 3. Okay, so wash the area with the anti-rabies vaccine. No, we have to treat with a grade 3, and the correct answer is option number D. That is wash the area, up, give the full anti-rabies vaccination, plus we have to give immunoglobulins because यहाँ पे the most important catchy word is that patient is a case of HIV who is on the ART treatment. ART is an antiretroviral treatment. It is a case of HIV. Always remember this point. ठीक है? अगर patient HIV का है, so grade 1 treatment will be same, the local wound care. The grade 3 will be same. That is all the 3 actions. But grade 2 अगर है, so you have to treat as a grade 3. ठीक है? And this is the different regimen is a very, very important. So always see the keywords. Number 1, whether the person is having first time exposure or had the previous exposure and received the vaccine earlier. ठीक है, because अगर first time है तो you have to treat as a non-vaccinated. Intramuscular is the SN regime, intradermal is the Thai Red Cross regime which is preferred, and the higher intramuscular doses as the JARAB regime. ठीक है, but if the patient has previously received the vaccination, in that case, what is the duration of the exposure? If it is within the past 3 months, only the wound care we will be doing. But if it is past 3 months to 2 years, we have to give the 2 booster doses. And if it is beyond the 2 years, then we have to give the full vaccination. Okay? But if we are giving the pre-exposure prophylaxis, then it is the 3 doses, 0, 7 and 21 or 28. We have to repeat the booster every 2 years. This is for the professionals like veterinary doctors or forest officers. So see the buzzword, pre-exposure है या पोस्ट एक्सपोजर है. अगर पोस्ट एक्सपोजर है तो प्रीवियसली वैक्सीनेटेड है या नहीं है. अगर प्रीवियसली वैक्सीनेटेड है, so how much is the duration of the past vaccination? Based on that we will be deciding our management. ठीक है. Now in the exam we are having the smart application of our knowledge. Now we are only left with the 52 days. In this duration we cannot read each and every word. And here it is your smart study protocol will work. Means you know what are the high yield topics from each subject. You had already marked those high yield topics. So we are going to repeatedly reading these high yield topics with a quick multiple revisions. And the second part is that how smartly you are managing your time in the examination hall. That is a very, very important key point for your success. Mind my words, every student is entering the examination hall with the same level of knowledge, but it is coming out of the examination hall with a different score, because how you are performing under pressure in that limited 300 minutes, what we are getting in the 2 sessions, 150-minute each or 2.5 hour each, that how you are performing, how you are able to recall, how smartly you are managing your time will be affecting your performance. So smartly you have to study in the next 52 days, and smartly you have to answer your lengthy questions in the examination. The next is method of sewage disposal in old areas of the Delhi where no underground sewage pipeline system is present. Nowadays, for the past 3-4 exams, we are seeing that the topics related to the health planning and management, the health education, then environment, and the social and mental health is coming more and more. Okay, so we have to give importance to these topics also. So in the areas where we are not having the underground sewage pipeline, because if you had an underground sewage pipeline, the sewage is going to the sewage treatment plant, and where we are having the aerobic oxidation. But if it is not having an underground sewage pipeline, so we are having the septic tanks in the individual houses. So septic tank mein we are having the anaerobic oxidation. Okay. Study plan will be coming soon, beta. I need your guidance. It was a wrong time. I never studied the pharma, patho, PSM and gynecology properly. I'll be joining missed to beta. I'll answer in the end. Okay? Or you can just message me on a personal chat. It will be difficult for me to answer here is because we are running short of the time. The yes, beta, very soon will be coming the study plan. Okay? So here it is not the aeration tank because it is a part of sewage treatment plan. So it is in the septic tank, and septic tank may inside the septic tank we are having the anaerobic oxidation. Okay? So yes, you are answering correct. So option B is the correct answer. Now coming to some of the important pointers from environment. The most important bacteriological indicator of water contamination is that it should be that is E. coli if it is present there. Most important air pollutant is carbon monoxide. The best indicator of the air pollution is sulfur dioxide. The most important content of the greenhouse gases is carbon dioxide. McArdle index is, that is maximum upper limit of sweat loss body can tolerate, is 4.5 liters. Mosquito control in urban areas, we are focusing on larvas. And in the rural areas, we are focusing on anti-adult. Chemical used to kill the Anopheles larva is because they are the surface floaters. It is Paris green dust. Biological method for larva control is putting Gambusia fishes. Frequency of the malathion spray is every 3 monthly because it is a residual, a synthetic product. Then mosquito breeding in the rice paddy field, it is an artificial collection, not artificial, sorry, it's a dirty water collection is, then Culex is breeding and there is a risk of Japanese encephalitis in that area. Now the next is a lady has completed her family after giving birth to her last desired number of the child. She is entering in which phase of the family cycle? Very commonly asked question. After giving the birth to the last desired child means she has extension or she has a complete extension or she has a retraction. So yes, you all are answering correct. Beta, it is not the option A, Abhijit, because if her first baby is born, then she is entering in the extension. Now she has given the last desired child, so she is completing the family. So it is the complete extension. So we should be not having any confusion. So marriage, it is the formation before the birth of the first child. Birth of the first child is the extension till before the birth of the last child. If the birth of the last child is happening, it is the complete extension. Before the first child is leaving. First child is leaving, then it is the retraction. The last child is leaving, it is the complete retraction. The death of the spouse, it is dissolution, and the death of the survivor is extinction of the family. So these are the different family phases, and repeatedly the question is asked from this. We know that in this journey, time will come, or you might have experienced that you are so much tired. अब मेरे से नहीं होता यार, मैं तो छोड़ दूंगा, ठीक है? But beta, only the few days are left, so you are not supposed to stop at this point. इतना आगे तक आ गए हो, तो अब आप पीछे मुड़ के नहीं जा सकते, ठीक है? Only you have to stop when you are done at the 4:30 p.m. when you are coming out of an examination hall with a smooth, good smile, big smile on your face that yes, you are done. Then only you have to stop. Okay? Only few days are left. So just go on, just go on. जितना भी आप अपनी maximum energy लगा सकते हो, just go on. ठीक है? Now another question. A survey report says high prevalence of anemia in the pregnant ladies in some remote villages of Rajasthan. Government issue orders for investigation and the team submitted its report after 30 days, which says that ASHA workers are motivating them for proper antenatal care. These ladies are visiting regularly at the ICDS centers where iron folic acid tablets are regularly distributed, but still anemia prevalence is high. The most important barrier for health education. They know that iron tablets should be taken. They are receiving the iron tablets. So it is not a physiological barrier, means their hearing problem is okay. They are understanding that I have to take this iron tablet. It is not an environmental barrier, means ऐसा नहीं कि they are not being provided the tablets. Tablet की shortage है, ऐसा भी नहीं है, ठीक है? साइकोलॉजिकल बैरियर ऐसा भी नहीं है कि वो बेवकूफ है, मेंटली रिटार्डेड है, समझती भी हैं कि भाई उन टैबलेट लेना चाहिए, उससे हीमोग्लोबिन इंप्रूव होगा. But what the culture they are following in the family, they have seen that their grandmother has not taken, their mother has not taken, then grandmother-in-law, mother-in-law has not taken. So they thought that if they are starting a new, we can say, strategy or new action in a pregnancy, कोई नया काम शुरू करेंगे, and if anything happens wrong with this pregnancy, they blame this action कि भाई वो जो लेडी थी उसने एक नया काम कर दिया कि उसने दवाई खा ली प्रेगनेंसी में और देखो क्या हो गया, बच्चा खराब हो गया. तो ये एक नेगेटिव मैसेज जाता है कम्युनिटी में, ठीक है. सो दे हैड अ कल्चरल बैरियर and because of that they are not taking, so it is a cultural barrier for that. Death of the survivor means the last member of the family is dead. Death of the survivor, yes beta, like in a spouse, the husband may die first or the wife may die first, okay. So that is the dissolution of the family, and the survivor means what is the remaining person in the family. If it is dying, that family of that couple is extinction, but the children family will start, but that couple family will extinct, okay. Now coming to the next question is, after 3 years of including 7 new vaccines in the intensified mission in the Dhanush program, the government of India is conducting a survey to assess the under 5 mortality rate, infant mortality rate in the country to justify its 1000 crore rupees investment in this upcoming in the program. And type of this management technique is, now here what we are comparing, and the government is spending money, okay. So input is what? Money. But what is an output? Is the reduction in the infant mortality and under 5 mortality rate. So government has to justify in the parliament in front of the opposition that we had invested 1000 crore rupees at a correct place. ठीक है, वो कहेंगे भाई क्या हुआ, फायदा हुआ, कहाँ लगाए 1000 crore, आपने अपनी जेब में तो नहीं भर लिए, ठीक है. So they are saying no, we had a gross reduction in the infant mortality rate and under 5 mortality. So money, and the result is what? It is the effect. So it is your cost effective analysis, ठीक है. It is not beta the work sampling. Work sampling में क्या होता है, that how many manpower is needed, doctor or nurses are required as per the work. That is what is a work sampling. कि अगर आपको दिन में ज्यादा काम है तो आपको जो है वो ज्यादा स्टाफ चाहिए, नाइट में कम काम है नाइट में कम स्टाफ चाहिए. So that is work sampling. Network analysis is a graphical plan, one by one this action will be done and how much time will be needed. That is a network analysis. Cost benefit, matlab money you had put and what is the money in the result, okay. So input and output, if it is compared in terms of money, that is a cost benefit analysis. So it is your cost effective because result is the reduction in the IMR, okay. Always till the exam, not only till the exam, in future also, that you should be positive. You have to think positive. No negative thought should be coming in your mind. अरे क्या होगा एग्जाम में, इस बार मैं पास हो पाऊंगा कि नहीं हो पाऊंगा, पिछली बार का तो पेपर डिफिकल्ट आया था, इस बार का जो है वो डिफिकल्टी आएगा या इजी आएगा. सो दीज नेगेटिव थॉट्स शुड नॉट बी कमिंग इन योर माइंड, बिकॉज yes, you can do, you can make, you can clear your exam at any cost, ठीक है. Always think positive. And the last question of the session is, Mr. RK, a young software engineer, was suffering with hypertension, but he ignored it due to work pressure. Suddenly on his 50th birthday, he collapsed and hospitalized, were diagnosed as a case of severe hypertension with brain hemorrhage, okay. So Mr. X was, when reached at a 50 years पे, suddenly had the brain hemorrhage, ठीक है, and hemiplegia, and remained in this stage for the next 5 years before the death. It means he was in a state of paralysis, that is the disability, and he died at the age of 55 years, ठीक है. He lives in the paralysis disability. Now calculate the DALI for this given case if a normal lifespan of the country is 70 years. So normal lifespan of the country is 70 years. So 70 years was the normal lifespan. Now calculate the DALI for this situation. Again there is a big trap here, and let me see कि मेरी मछलियां फंस रही हैं उसमें या नहीं फंस रही हैं, ठीक है. मेरी मछलियां फंस रही हैं, सारी मछलियां फंस गई हैं, फंस गई हैं. Just see. Now What is the DALI? DALI is the disability adjusted life years. ठीक है? यस बेटा मुकेश, एक्सीलेंट। ये मछली नहीं फंसी, ठीक है? रोमिंग की भी मछली नहीं, रोमिंग की भी मछली फंस गई है। देन व्हाट्सएप की मछली निकल आई है बाहर। अब धीरे धीरे मछलियां निकल रही हैं, ठीक है? नाउ जस्ट सी, डाली हैज द टू component. One component is that is years lived with the disability. Years lived with the disability, and यहाँ पे कितने साल disability में हुआ? 5 years he lived with the paralysis. Second component is year which is in the life lost because of the premature death. Normal lifespan कितना था? 70 years था। तो कितने साल पहले वो premature death हुआ? 15 years का। So that is also a part of DALI. ठीक है? So part of the DALI will be the year which is prematurely lost is 15 plus the year which is lived with the disability is 5. So total DALI here will be 20. अगर इस केस में if this line is not given, the lifespan is 70 years, then your DALI will be 5. ठीक है? But अगर यहाँ पे the lifespan दिया है and the premature life is there, then we have to calculate that area also. ठीक है? So live with the disability with the premature death. So 20 year, or it is not the year, so 20 will be the DALI for that. ठीक है? So this is the last question. Now the one question was that is these topics are enough for the revision? No beta, because we are having short of the time, so we could not take the some other important topics. Still some topics are left, like biomedical waste management, the disaster management, the occupational health, because I have to restrict myself to 25 important questions, so I could not take those topics. So those topics are also important. Okay? So what we had discussed in our live classes, the important topics, we should be going for those topics. Now डेली थोड़ा सा अपने आप को ज्यादा एक्सर्ट करने की कोशिश करो, ठीक है? अगर किसी दिन आपको ऐसा लगे कि आपने 50 क्वेश्चंस कर लिए, नाउ यू आर एग्जॉस्टेड, यू आर रिवाइज द 2 टॉपिक्स 3 टॉपिक्स, नाउ जस्ट ट्राई टू रीड अ 1 or 2 पेज मोर और डू अ 5 more questions. So little more exertion or the hard work if you are doing, then definitely you are making your tomorrow beautiful. And we all are waiting that beautiful day, that when you will be jumping with joy. ठीक है? बस एक दिन, एक रिजल्ट, और पूरी दुनिया आपकी कहानी सुनेगी एंड आपसे पूछना चाहेगी, सर, मैम, भैया, दीदी, आपकी क्या स्ट्रैटेजी थी? आपने कैसे किया ये मिरेकल? आपने कैसे इतना अच्छा स्कोर लिया है? ठीक है? एंड so in the end, what I can say is good luck to all for your exams. So we all wishing the best for your grand success in the upcoming examination. Okay. So with this, we had completed the 25 important topics and the related pointers. I'll wait if you had some doubts, so we can be going for that. Okay. How to manage the time in the long questions? Long question mein, as I say, beta, you have to work smartly. Like you have to see the image if it is given. You have to see the last 2 lines and see the choices. Because sometimes in the question, you don't know whether the question is being asked from the medicine, from the pharma, from anatomy, or from a gynae, from pedia, from the PSM. So with the choices, you had an idea that from this area the question is asked, and then you will be getting your answer. How to the errors? Yes, beta. Errors mein, beta, you have to see the 2 type of errors are there. One is a sample error, because we are not studying in a the whole population, we are studying in a sample population. So definitely there is a difference in the result of the sample population and the actual population. The second will be the bias. What we say is because of the person who are in the study. The one could be the subjective bias, the patients who are in the study, and this could be corrected by the single blinding. They could be the observation or the investigator bias, who can be making error in the selection, and it is corrected by the randomization. And there could be the interviewer bias, we are not giving a proper time for interview, and it is corrected by the double blinding. ठीक है, तो subjective error is corrected by the single blinding, and the interviewer error is corrected by the double blinding, and there could be the analyzer error in the analysis, that is corrected in the triple blinding. ठीक है, and we can be having another is a confounding error. It is both known and unknown confounding error is corrected by randomization. Unknown confounding error, it is corrected by matching, which is in the case control study. Okay? And in the cohort study, we can do matching. And best is by the randomization for confounding error. Okay? This is what we have to remember. Then any video on the numerical practice, beta, few days before the exam, I'll be taking another live session for the numericals, or by the time you can go with the previous two sessions, the numerical session, it is uploaded in the MIST YouTube channel. Okay. We will be coming with the recent session also. मेरा PSM गायनेकोलॉजी वाला पोर्शन वीक है, बेटा अभी भी टाइम है, आपको स्ट्रॉन्ग करना है, बिकॉज ये दोनों सब्जेक्ट्स बहुत इंपॉर्टेंट है, मेजर सब्जेक्ट्स हैं, एंड टोटल विल बी हैविंग अराउंड 65 to 70 क्वेश्चंस. ठीक है, annotated PDF how to get, बेटा I'll be uploading, and in this you'll be getting in the link of this video. ठीक है, ATT treatment, beta, as I say that WHO has given a modified treatment for the drug sensitive TB, but अभी government of India ने accept नहीं किया है. ठीक है, so it will be the same for our exam. Can we get the important topic list to revise before the exam? Okay. If you had attended the live classes, definitely, I had already told you that these are the important topics, but still you will be getting the list. ठीक है, PSM gynecology वाला question था मेरा, I don't know how to contact you. Okay, I think if you are in the so you can get my the WhatsApp number. So this is my WhatsApp number. It is 7042109995. Okay, so this is my WhatsApp number, so you can message on that. Okay, can we get this you cleared the FMGE, great beta. So all the best wishes for your upcoming NEET PG exam. So any doubt, any query? Okay. So thank you very much for your patience hearing, and if you are closing this session, and wishing you once again all the best for your upcoming exam. Bye-bye. See you. God bless.